Welcome everybody back to this international conference on planetary health. For the people that join us for the first time, Dr. Jordi Serrano, and the curator of the event.
Welcome everybody again to the International Planetary Health Conference. Laura.
Yes, thank you very much. Welcome another time. Jordi Serrano and myself, Laura Cogat, will be presenting this second day conference of this event. But first of all, we want to make a summary about what's going to be the first edition. First of all, but we want to remind that you can follow us here in person at the San Julia Congress Center or virtually by streaming. Yesterday was a great day. We start with the opening and the inaugural session. And then we move on 3 roundtables and a late talk about mental health. About all these interventions and roundtables, our objectives are to bring more information and details about this new interdisciplinary concept, planetary health. Also, we want to update the current scenario, and also we want to motivate people and audience to participate in these discussions and debates. For example, yesterday we have been talking about the impacts on on the environment and its consequences. Also, the big need to protect vulnerable communities, for example, children. Also, we talk about the wide range of opportunity that give us the digitalization and the data. And also, we talk about the important role that have education and the political commitments and compromises. So, with all these objectives and all these goals, we want to discuss, we want to make the audience think, reflect about these planetary health objectives and challenges. About yesterday, Jordi gonna give us more details about that.
Very quickly. Thank you very much again. We have to remember which are the objectives of this Planetary Health Conference. First of all, we want to bring closer this new concept, this new field, to general population and also especially to healthcare workers. We have seen yesterday that there are new paradigms and that these populations can really take advantage of that. Second objective that we want to draft some conclusions after today to start, if potentially, a white paper on that field. Yesterday, as Laura was explaining, we had the opening session with the authorities, and then we moved with the Minister of Health, with the Rector of the University of Andorra, Director of Research and Innovation Foundation, the Director of SAS, and then we moved to the inaugural session, when Dr. Maria Piqué led a conversation between Elena Villalobos of WHO, Oisin Brady of the Primary Care Networks of Vasco da Gama Physician Planetary Health Networks, Cristina O'Callaghan from IS Global, and Fernando Garcia, from Instituto Carlos III. The discussion was great, and it was the Quo Vadis Planetary Health. It was a great conversation, and we could have an initial point of view from where we are now. Then we move forward with the roundtable 1. We had Deborah Thompson from One Health, Fran Campillo, Eduardo Celades, Clara Prats, and John Carlos Marx. Deborah was amazing explaining how we can teach children concepts that we never thought that even we would teach to teenagers. That was great. Fran Campillo explained how the environmental units, pediatric environmental units, can change the mentality from the beginning to the parents that are delivering a baby. Remember that they are going home with a tree, they go back to hospitals to take care of another tree that they are planting, and so on. We continued also with Eduardo Celades from Nigeria. He was on the field. He had come just 5 minutes before from a meeting from a governor of Nigeria, so we have to thank him a lot. He's responsible of UNICEF Nigeria, okay? With a lot of responsibility, delivering vaccines, implementing health policies, and the key message was we still need to implement many things in many places. And he explained the difference between how health was implemented in places where agriculture is the main resource or in places where cattle is the main resource, pure planetary health. And Clara Prats made a wonderful speech about data, and not only data, what is the meaning behind data, the reflection, what that data means, and in the surroundings of that data. And John Carlos Marx, as always, started to talk about the social network of the patients in that sense. Roundtable 2, Miguel Ángel Royo from Instituto Carlos III also explained very well how health policies, health food policies can be implemented and how difficult they are to implement. Dr. Pedro Albajar from WHO also explained about all the importance of interoperability between fields and how not to miss opportunities of systematic integration. He explained how, for example, in many places, doing screening of Chagas are done in the moment that they did also screenings for COVID tests, in the same moment where people from Bolivia, for example, went to vote for the national elections. We have to take advantage of these opportunities of systematic integration to move forward. Luis Augusto, one of the fathers of planetary health, basically explained the transition and how the knowledge and how the evolution of thinking have been in the last 20, 30 years, from environmental epidemiologists to the planetary health concepts, and explained the countdown of Planetary Health Alliance. Super interesting. And Irene Corbella from the Department of Public Health of Catalonia, she explained very well the policies from the regional government of Catalonia about environmental and sustainability. This meeting was led by Sylvia Ferrer, and the first one was made by, sorry about the lapsus, who was well, it will come back. And the roundtable 3, one lapsus, one a day, okay? Roundtable 3 was digital health table, digital opportunities for planetary health. It was led by Aline Noizet. Stephen Butik from Malta was explaining how small states can really implement digital public health solutions. Andorra is a small state, and we can take advantage of that. Anish Indore, entrepreneur, expert in digital health, explained how we have to confront the future with pensions and many other things in digital and in sustainable way. Alberto Bello talked also about data. Alfonso Valencia also about big quantities of data with the Mare Nostrum computer, and myself also, I talk about the possibilities of digital and planetary health. So thank you very much, and from that, let's load the video, the complete video to situate the speakers today about all these possibilities with the Mireia Garcia from the Ministry of Health did that roundtable. She did very well, by the way. Next one is your roundtable. And later, after the break, we have the roundtable 5, biodiversity and social indicators. All these images, the frog that disappeared, the seagull that transports the bacteria, resistant bacteria around the wall, the polluted wall, the Milky Way that we cannot see anymore, polluted, and finally our hope that we can really have these wonderful waters with us for a clean planet, like we also wish that we have clean vessels of our own body. Thank you very much, and we are introducing now round table 4.
Yes, we move on to roundtable 4 entitled Research for Healthier Population. Non-communicable diseases, aging, infection diseases, and mental health are all affected by the deregulation and the pollution of ecosystems. And research on the human population must take into account the planetary health challenges to offer and to propose preventive solutions. We will talk about these issues and many more with our speakers, and we will focus particularly on the growing aging population. In this occasion, we welcome Salvador Masip from the University of Leicester, Marco Inzitari from the Pere Virgili Health Park, Eva Eras, head of the Aging and Health Department at the Andorran Healthcare System, David Villanova, head of the National Laboratory of Epidemiology at the Andorran Ministry of Health, and Cristina Arroyo from the Andorran Healthcare System.
Thank you very much, Laura. We don't need to pass again the roundtable 4 video because we have already passed that. And with that, Ana Boada will be leading, Dr. Ana Boada from this Andorran Healthcare System, rehabilitation expert. Thank you, Ana.
Good morning and welcome, everyone. First of all, thank you, the organizers, for inviting me to moderate this roundtable, and also all the speakers we have here. And today's meeting will focus, as Laura has already said, on growing aging population, human microbiome, and antibiotic resistance changing status. So let me please introduce our first speaker, who's Salvador Masip. He's an expert doctor in cancer and aging. He has worked in Mount Sinai Hospital in New York, doing research in cancer and aging. And since 2008, he's the chief of mechanism and cancer and aging lab in Leicester University in the UK, and also works there as a teacher. Here since 2020, he also teaches in the Universitat Oberta de Catalunya. Please, Salvador, the floor is yours.
Thank you very much. Thank you, the organizers, for inviting me. And my job this morning is to sort of open this debate on one of the challenges that I think is very, very important for the future for planetary health, which is what do we do and how do we deal with this, the aging populations? How do we manage? How can we drive towards healthier aging? And my take on this is from the biological point of view. I do research on the biological basis of aging. So I'm going to be telling you how we on the lab see what aging means and what can we do about it. So when we're young, there's a series of diseases that are not that prevalent. So in a young person, we're not going to see a lot of heart diseases, diabetes, cancer. That's something that doesn't happen when you're young. As we get older, all these diseases start becoming more prevalent. So there's something in aging that is a risk factor for a series of diseases. And there's plenty of graphs that you can look at, like diabetes, heart attack, cancer, dementia. All these increases with aging, as you would expect. And the most important one, and this may seem silly, but the older we are, the more chances we have of dying. So being old is the most important risk factor of death. So there is this part of our life, towards the end of our life, where we are at an increased risk of disease and death. So because of this, some people in the field of aging, especially from the biological point of view, are starting to consider whether aging itself could be also classed as a disease. And every time I see this, everybody working on geriatrics want to kill me, because they're always trying to see aging from the other point of view. But from the biological point of view, aging now has a series of steps, a series of pathways, a series of changes at a genetic level, at a cellular level, at a molecular level, that are very similar to what you would see in other diseases. So the question is, and it's more a philosophical question than perhaps a practical question, if we can consider aging a disease, is there a cure for that? So is there anything we can do about aging from the biological point of view to slow it down, stop it, reverse it, or anything to sort of reduce these chances of getting disease and dying as we get older. And this statue that you see here is a representation of Gilgamesh, which is the first epic hero that has survived, the first story ever written. Is about a person that, in this case, a king, that is trying to find the cure for aging, basically is trying to be immortal. So this is something that's been in the mind of humans from the very beginning. How is there a way to improve this degradation we see in our bodies as we age? And what I'm going to try to show you today is that in the labs we are getting closer to that point to try to find ways to sort of disconnect these mechanisms of aging. So the first, if we want to find ways to cure aging or to stop aging, the first question is, why do we age? And this is where we are in the labs working right now. From the microscopic point of view, obviously, everybody understands what aging is. You can see visually what the changes that aging brings in the body are very visible from being born to getting old. Now, if you go inside, we see that our organs are also changing. So the liver, the brain, the kidney, all the organs of a newborn are morphologically, not only morphologically, but also obviously functionally, very different from somebody that is already aged. So there is a change there. So we could say that we age because our organs age. And that's something, again, that's been known for a while. Now we're at a different level. Now we are moving towards a deeper understanding of aging, and we say that we age because our cells age. So if we go deep into these tissues, we see that the composition of these tissues is different. And particularly these guys here, the senescent cells, what we call the old cells, are increasing in proportion as we get older. So there is some sort of a cellular aging, some sort of aging at a cellular level that we are beginning to understand, beginning to see, and beginning to be able to do something about it. Once we know what we have to work with, what is causing, we think, these changes at the organism level, then we can start doing things about that. And aging nowadays, there's a confluence of theories that are trying to explain, to answer this question, why we age. Traditionally, there's been two big groups of theories that explain aging. One is the genetic or programmed aging. The other one is the wear and tear or stochastic aging theories. So the genetic side is this biological clock, the immune theory, the programmed longevity, things that basically tell us that our aging is determined by our genes. And if you think about how different species age, obviously there's some sort of an aging program that makes humans live until 80 or more, and mice only live 2 years. So there has to be something at the genetical level. But also, there is this sort of more context-dependent, stochastic things that lead to aging. And this is the oxidant theory, metabolism, inflammation, and so on, that also lead to these changes we see at the cellular level. And what we think now is the conjunction of these two sets of things that are happening that explain why do we age. So there is a genetic programmed part of aging, and stochastic, more environmental kind of aging. And this leads to these 9 factors that this is in 2013 this was published, the hallmarks of aging. This is probably the most revolutionary paper that we had in aging recently, that tried to explain these 9 factors of why we age. We're not going to go over this because that could take us all morning, but we think that these are the 9 things that happen at the cellular level and molecular level that cause aging. So again, now if we know what causes aging, now we can try to do things. Some of it would sound familiar to you, like telomeres. Telomeres get shortened. Can we make them longer? Stem cells kind of get lost. Can we replenish stem cells? There's a lot of examples of things that are trying to be done at this point. And particularly today, I would like to talk to you about senescence, this sort of endpoint of all these other factors that eventually lead to this accumulation of old cells that I was showing you before. Basically, the concept is that after damage, these senescent cells appear. As we get older, there's more and more damage. When we are young, these senescent cells are potentially clear from the tissues, and the tissues can regenerate. So when we're young, everything is fine. When we are old, and we think that this explains a lot of the things we see in aging, there's this accumulation of these old senescent cells, the immune system trying to clear them, the fibroblasts coming, they're trying to repair the tissue and not being able to. And this mess is basically what leads to aging. So one of the crucial triggers of aging would be this accumulation of old cells. And basically that would be the representation. As we get older, more and more senescent cells in the body, more and more failure in the organs, more and more problems we have at the functional level. This leads not only to aging, but a lot of diseases. All these diseases you see here are diseases in which senescent cells have been involved. So if we find a way to clear senescent cells from the body, we should be able to reduce things like neurological disorders, pulmonary fibrosis, cancer itself, obesity, diabetes. All these are diseases not caused by the old cells, but enhanced by the presence of senescent cells. So we have now something that we can do to try to reduce all these pathologies that we see with old age. This was done in a mice. This was until here, what I said so far could be seen as a hypothesis, a theory. This is the first proof, and this is 2011, showing that this can be done for real. You can eliminate senescent cells from a mouse, and this mouse lives longer and healthier. So we've done that. We've delayed aging in animals by getting rid of these old senescent cells. Now the question is, can we do this in humans? That's what we are trying to do now, for instance, in my lab, using something, a drug, the BTK inhibitors, that we think prevent this accumulation of senescent cells. And I'll show you a quick example. This is a cognitive test that we do in mice, a memory test, that as the mice get older, they lose, obviously, their ability to, for instance, like this one is a spatial memory, so they lose the spatial memory. And we train these mice for some time when they're young to find this box here. So you see this hole here at the top of this table, this round table. There's only one exit that has a box, and the mice are going to look for that box because they don't like to be in the open, so they're going to go and look for shelter in that box. So we train them to find that box until they remember where it is, and then when they're older, and this is a fast-aging mice, so we can compress this experiment. When they're older, we put them again in this what we call a maze, and we ask them, do you remember where is the exit? And that's, again, a test of spatial memory that with aging goes down. So if you pass the first video, please, you will see here on the left, this, on the other, that one, you see a mouse that is old and is trying to remember where the exit was. So you see, it doesn't remember very well, keeps trying. All these holes have no exit, there's no box at the bottom. So eventually, after 20, 30 seconds, something clicks and say, oh yeah, that's where it was. So it goes back at the top. Now, if you go on the right, that's a mice of the same age that has been treated with a drug to stop aging. So second video, please. And it goes straight to the box. And the numbers are basically here. So all mice take around 15, 20 seconds to find the exit. If we disconnect aging with this drug, which reduces senescent cells, these mice remember much better. It's an example, we did more experiments with this, of how we can delay this loss of cognitive function in mice. Now again, can this be done in humans? Now this is a drug that could be given to humans. It has a lot of side effects and things, so perhaps it's not this drug, but perhaps another iteration of this drug could be something that could delay, obviously not cure, not reverse, but perhaps delay somewhat some of the things that we see in aging. Now, this leading to the theme of these talks, it's basically how do we fit all these potential things that we're doing to improve aging, to change this outcome of aging, to improve the health of all people in this concept of planetary health. What we've been seeing in the last, for decades, but particularly in the last decade, is this increase in life expectancy. With this, we have men on the left, women on the right. The life expectancy has been increasing steadily in the past years. But if you look at this, so this purple area is basically the increase in life expectancy, but the light blue at the bottom is the increase of health. So if you see, healthy years have not increased. We're living more years, but in bad health. So if you compare here, the amount of healthy years are the same, but we're living more time. So the more we live, the more problems we have. The more diseases we have, the less healthy we are. And this is not changing. So how can we act upon this part here? So because what we want, I mean, when we talk about aging and from the biological point of view, often you say, like, why do you want to just prolong life? We all are going to end up like this. Like, if you live 200 years, eventually you're going to be non-functional like this person. What we really want is this. We want some healthy aging. This is different. What's the difference between this and this? Why? How can we foster this sort of healthy aging and not this? So it's not adding years, but adding health, basically, to the years that we already have. This is the difference, I think, a very important concept that has been around, and especially recently has been very much discussed. The difference between lifespan, which is how long we live, the span of our life, how long we live, versus health span, which is for how long we are healthy, as the WHO describes this. is the average number of years with
Sorry,
full
Dr.
health.
Masip, just 1 minute left.
Okay. So this is where the difference that we have to try to increase health span versus lifespan. And this is what we did in our mice, for instance. We increased the health span, but we increased, sorry, the lifespan, but we also increased the health span. And that's, I think, the most important outcome of what we're doing in the lab. There's other things that I was saying that can be done. The idea is this: can we somehow find a fountain of youth that would keep us healthier for longer times? The downside of this, obviously, is that we already have, we live in a planet where the resources are limited. So these are the challenges, I think, that we are facing if we really manage to get to lifespan and health span extension. How do we deal with overpopulation? How do we deal with these inverted pyramids of health pyramids? This is what you see in some African countries, for instance. This is United Kingdom, how we get more and more older people, less and less young people. This is going to be exacerbated if we really can improve lifespan and health span. The social burden of the people getting older but being still productive, what they're going to do with the age of retirement, that sort of things, and who is going to have access to these anti-aging drugs that we are cooking in the lab. Is this going to be something only for rich people, and so on? So that's what we're doing. That's what we're trying to study at the WOC at the University of Catalunya, where we have this master on healthy aging, and we want to bring all these questions, bring together biology and all these different challenges. And the first part of this master is starting this year for anybody interested on aging, nutrition, and quality of life with all these partners that we have. Thank you very much.
Thank you. Thank you, Dr. Masip. I'm sure a lot of questions will come up from the audience, but we will keep them in mind, and we'll do a brief discussion afterwards. Okay, now it's time for Marco Incitari to do his talk. Marco Incitari is a specialist in geriatric medicine and master in healthcare leadership and management. He served as a director of integrated care and research at Parc Sanitari Vera Virgili, and as a professor of aging at University of Catalunya with Dr. Masip. He's a principal investigator of the research on aging, fertility, and care transitions in the Vall d'Hebron Institute of Research. Please, the floor is yours.
Thank you so much, and thank you for the kind invitation. It's a pleasure to be here in Andorra. I will shift from the lab to probably other labs with humans, but also try to make you understand somehow or think with you how can we implement strategies to bring healthy aging in the real life. I have no conflict of interest, but just I have to agree different partners and funding sources for this talk. And I want to start with a seminal paper in aging. This was 1980, and this geriatrician and researcher, James Fries, was already overseeing, let's say, the potential of moving the active life expectancy and delaying, let's say, disability. According to what Salvador has been telling you, our lifespan will be increased thanks to the advances in research. What we have to decide if we want to keep the active life expectancy or the health span, as he was saying, where it is, or can we delay it, okay? Of course, he was talking about cellular targets to increase health span, but we, let's say, already know that we can do something about that. And where and when can we act in this moment? This is what the World Health Organization is telling us. It's very interesting, this shift from disease and deficit to intrinsic capacity, so potential and reserve of aging. And I think Eva, after myself, will talk more about that. So if the intrinsic capacity or the reserve of the patient is declining like that across lifespan, here, of course, when the intrinsic capacity is very low, it's very hard to think to really revert, let's say, the negative consequences of aging and recover the functional ability. You see the potential for the red arrow, which is like the, let's say, reversible part of the decline is very, very low. So we have to act a bit earlier, and this is the great phase and the great target when the capacity declines. Of course, we have to give, let's say, or allow policies to have better health for everyone, and promote healthy aging from the beginning of life. But when we really have to push hard and be intense in intervention to promote healthy aging, is here where the capacity declines. It's what we in geriatrics talk about frailty, but in the new and modern concept of the WHO is probably better seen as declining capacity. And this is where we are trying to act in our programs. As I was saying, we have a magic pill, so we waiting for Salvador delivering his medicine. We have a magic pill, and this magic pill is not a pill, but is a combination of changing in healthy habits, and in particular promoting exercise and nutrition are the intervention with more scientific evidence. Here you can see a lot of citation from different countries, and we know that this works. I mean, why should we do more research about that? We know that this program really work at least in the lab, as I was saying. The lab is not the mice lab, but is like controlled experiments, randomized controlled trials where the setting is very much controlled and all the condition, and there are resources to do that. The problem is that we are not really able to translate this from the evidence that we produce to the real life. So the implementation gap is very hard, and it is what we are trying to do in the Aging Barcelona program, which is not a research project. It means that we do research on a program which is implemented in real life. Before starting the Aging Barcelona program, which is in place since 2016 in Barcelona, we did the consensus with different agents, primary care physicians, community agents, and so on, and we came up with this decalogue. How should we implement this kind of interventions? And this, I think, can be very useful to contextualize and apply this in different contexts. Some tips. We need multifactorial strategies. The aging is a very complex problem, so doing one intervention at a time doesn't work. So we need to combine exercise, nutrition, and other changes in lifestyle. It has to be patient-centered or person-centered. One fits for all in aging doesn't work. So older adults doesn't really mean anything. There is a broad spectrum of older people, and we need, of course, within a limited range of possibility to individualize our offer, and I think this is what also Eva will tell you with more precision. Of course, we have to contextualize intervention because Andorra is different from Barcelona, and Barcelona is different from New York or from, I don't know, African countries. So, or even within these places, there is a great variability, so we really need to contextualize our interventions. We need to integrate different resources to allow participation of users in the co-design of the programs, and we need to bring the intervention close to the person. So we have to get out from our hospital or centers and go into the community. And this is exactly, these are exactly the pillars of the Aging Barcelona program. The first one is integrated care. So we integrated primary care, geriatric resources with community resources close to the person. We foster user participation. So here you can see one of our participants participating in co-design groups at the beginning of the program, because we need to allow, let's say, more contextualized intervention and to foster the adherence of the person. And also we push on the co-responsibility of managing our own health. And of course, we need to look at the sustainability of these programs. We don't have research funds in general to promote this program, so we need to really understand what is there in the community and try to integrate the existing resources. This is the scheme of our Agile program. So there is a first alliance between primary care and geriatrics in the primary care center. So they do a comprehensive geriatric assessment, and they offer a tailored intervention plan depending on the person's needs. The star of the plan is this exercise program, 10 sessions, 1 a week. This is not very great intensity, but is what our older participants told us that they could stand and what they could follow, really, because they are, in general, still functioning people, so they have commitments, and they cannot commit like to exercise 5 days a week, as in many clinical trials. Then we have a bunch of other options, adherence to Mediterranean diet, sleep care, detection and management of loneliness, quality decline, and so on. There is one unique only follow-up at 3 months, and then there is a continuation of the program in the community thanks to the existing community resources. The problem is how to make it sustainable. we have the 3 months of boost of this intervention promoted by the healthcare professionals, but then we have different leverage. For example, we work with motivational interviewing to really make the person responsible to continue the exercise and intervention. We use digital application, and I think then Eva will explain more about the Viviflare application that we also use in our program. And the most important part is that we connected the existing community resources. So we, for example, we designed a continuation program in the civic center with resources that were already there, or we, let's say, direct the person to the best option to keep active with exercise and so on in the community, depending on their functional status, but also socioeconomic status. Very briefly, these are some, we published the results at 3 months, and as you can see, there is an increase of physical function, which is our main outcome, because this is a great proxy for disability over time, and there is an improvement of physical function. But also when we stop the directed intervention in the healthcare center at 3 months, of course there is a maintenance at 6 months, which is in people with 82, 83 years of age at the beginning, is a significant improvement, let's say. During the pandemic, of course, there is a slight decline, but the physical function was still maintained. These are the publication with the reduced number, but we have also more than 400 people in the program, which runs once a week in this moment in one primary care center in Barcelona. The pandemic was a great challenge, of course. So here we could follow up our cohort of the Agile program with the surveys, form surveys, using the same instruments that we used in the in-person screening, and we saw that 30% of them became completely inactive from the physical point of view, so they stopped to do physical activity, even if 20% were still following our recommendation, the Agile recommendation. And there were a bunch of factors, let's say, associated with the reduction in physical function. People which had more depressive symptoms, low social relationships before the pandemic, of course, were at high risk of becoming inactive, and also people that experienced more fatigue during the pandemics. Due to this, we thought that we should really push harder on the digital component of the program, because this would allow us to maintain this program in a challenging situation such as the pandemic, but also will allow us to a better scale up of the program in other areas. So this is what we did and what we are doing. We are working with WOC, with Carmen Carrion mainly. So we run focus groups to ask older people, but also health professional and third sector professional about which were the barriers and the ways to overcome, let's say, the digital barrier, which is really still important and relevant in older population. So we work about guidance and what do they need to, as a support, to use digital applications, but also which kind of exercises, which kind of gamification did they need to really embrace these new digital programs. We did a systematic review of apps to promote physical exercises, not in the literature, but in the marketplaces, in the Android or Google Play, and we are evaluating the usability, the clinical evidence to support these applications, and we are piloting this, let's say, reinforced digital program. Thanks to this, we are designing a new application, not directed to users, to final users as older people, but directed to prescribers of physical activity and exercise. There are many physical therapists, exercise physiologists, and other actors that need really to become more and more expert in a prescription of the physical exercise as it was a drug, let's say, how many times a day, how many hours, which intensity, which kind of exercises. So thanks to our research, we built an algorithm. So based on the physical function of the person, you have in front the cognitive function, their technological ability, and their preference, of course. The algorithm and the application that we are doing let's say, alliance with Universal Doctor and UDA, we will come up, the program will come up with a proposal of which kind of exercise you have to do in person, or which kind of application you can use, or which combination of the two. We really believe in the co-design, so all this is the base, no, to involve.
Sorry, Dr. Incitari, it's almost time.
To involve the users and also the companies in design new solutions. So this is the base of the new Aging Living Lab we are launching now in our environment. And of course, last point, we have to take account about the environment. So how do the environment can influence our interventions? And we are scaling up. This is where the program was, and we are scaling up this in 3 other areas of Barcelona, thanks to the, in this moment, to the Paris Research Funds. And we want to take account in the new scale up about new variables, so you have to take into account how the environment can influence our promotion of healthy aging. So in these environments can really have a differential impact of the green area services and so on. So this is the new paradigm we are following, and again, all these will be object of our master program, also in alliance with Andorran Healthcare Services and Board of Physicians of Barcelona. Thank you so much.
Thank you so much, Dr. Incitari. Now it's time for our next speaker, who's Eva Eras. Many of you will know her. She's a doctor in internal medicine physician specialist, chief of aging and health department in the Andorran healthcare system, and since 2020 has been collaborating with the World Health Organization Aging Department. Please, Eva.
Okay, you listen well? Yes. Okay, good morning, everyone. I want to thank also the organizers of the event for the invitation on the International Conference on Planetary Health. So it's a pleasure to be in this roundtable with such good speakers. And today I will talk about healthy aging and the relation maybe between healthy aging and climate change. And I will share with you the Andorran healthcare program also on this topic. So it's a global concept, that every person in every country in the world should have the opportunity to live a long and healthy life. So the environments in which we live can favor health, but also can be harmful to it. So all the people are especially vulnerable to climate-related threats like extreme heat, air and water pollution, floods, for example. So the environments we live in can favor health or be harmful to it. So the United Nations Decade of Healthy Aging, it's a global collaboration between governments, civil society, between professionals, media, private sector, and they want to ensure that all the people can fulfill the potential in dignity and inequality and healthy environment. So, I don't know what happened. I was here, I think, yes. So I was saying that in this series there's a description between the connection about climate change and aging in the decade of healthy aging, and among the proposals to support the resilience of older people to climate change, we find preventive health measures like the integrate care for older people. So the integrate care for older people is a guidance on person-centered assessment. We are collaborating with WHO, with the aging department of WHO, promoting the implementation of the integrated care for all the people. So in this handbook, you can find guidelines on community level to manage declines in intrinsic capacity with evidence-based recommendation for healthcare workers. So you may be wondering what is intrinsic capacity. Again. Sorry. Fa boicot això, Sí. Yes.
I'll put your presentation here if you want.
Talking a couple of minutes, so we'll give you more time because there's no technical problem.
Okay.
I'll give you your presentation already.
Yes.
you.
I think the presentation was, well, it's visual, no?
Well,
We'll give you more time, no worries. Count the time, like, no problem.
Well, the intrinsic capacity, I was saying, no? Marco already talked about the intrinsic capacity, comprise all the mental and physical well, sorry for that. But I was here and I was saying that, that it comprises all the mental and physical capacities that a person can draw on, and includes the ability to walk, to think, to see, to hear, and to remember. So here we see a person with all the domains, no? So when we think about the intrinsic capacity, the environmental factors and the interaction between the intrinsic capacity and the environmental factors is what we call the functional ability. So the functional ability has a lot to do with healthy aging. Here we see. So WHO has defined it, the healthy aging, as the process of developing and maintaining the functional ability that enables well-being in older age. It's about for older people to do what they like to do. Sorry, okay. So. Sorry, one moment, please. So we are participating together with India, China, and France. We are very happy to participate in this pilot implementation of the ICOP. And we start in Canillo in July, September 2020. And we have been keeping on doing these studies in other sites. Now we are in Escaldes, for example, and I will explain you later. So I had the chance to participate in a webinar on the 25th April, sharing my experience in the webinar that was held by the WHO, sharing my experience as a physician about this program, of the ICOP program. And we share also the results of the ready phase of the implementation of this program about Canillo. So we are very happy to participate. Andorra is a very small country, but I think it's an excellent living lab to do such studies. So here are the different sites of the studies of the pilots. The results that we share in the last meeting or the webinar were from Canillo, but we have been also in San Julián in 2021 with 137 participants, and currently we are in Escaldes and Gordain, where we have already assessed 260 participants. So we have continued with the ICOP program in all the sittings. It's important to say that there's always, when we start with these pilots, we have a collaboration between the Andorra Healthcare Service and the city councils, because it's very important to create the community in these programs. So the ICOP program includes 5 steps to meeting all the people's health and social care needs with an integrated care approach, as shown in the following general pathway. The first step is step 1, which is a quick screen of mobility, vision, audition, emotions, cognition, and nutrition. If one of the domains shows there's nutrition in one of the domains, we go to step 2, and step 2 is it's like a deeper assessment of it's like a geriatric assessment, we will say, with many scales. And I think we spend nearly 1 hour to do both, step 1 and step 2. And depending on the results of the step 2 is when we develop a personalized care plan that takes into account the declines that we have observed in the step 2. There's a step 4. The step 4 refers to the monitoring of this care plan. And after we have the step 5 that engage the communities on the project. So here I will share with you some slides, some pictures about the assessment. Here we have the nurses of the primary care that are collaborating with our department, with sensing the sensory capacity, the hearing and the vision, also the psychology capacity. We assess that, the locomotor capacity. This is the Shiras test and the GET speed. So as I told you, no, we spent nearly 1.5 hours, no, doing this assess. People really, no, are happy to further, no, when we can share with them the results. Well, we also check the vitality, the cognitive capacity, and depending on this evaluation is when we develop a personalized care plan. Well, as Marco Incitari said, no, the most important is to have a multimodal intervention that combines physical exercise, but also cognitive stimulation, socializing, leisure activities, and other. So in the physical activity, well, the physical exercise, what we use is Vivi Freire passports, no? That this Vivi Freire, well, we are also collaborating with Miquel Izquierdo, who is the designer, well, the creator of Vivi Freire, and it's very, very useful, no, for all this kind of passport, because you can do the exercise at home, no? So it's very, very easy. So I think, well, the most important, I am finishing, but the most important at the end is the feedback from the participants, no? So I will share with you a film of the participant that was released during the webinar on the 25th of May of the Biodiversity show with all the people from the 4 sites of the pilot program. So you can see it from Andorra, France, China, and India. So you can, the movie. It's 2 minutes, but I think it's important to have their feedbacks on this project.
Je m'appelle Micheline Ostruy, j'ai 82 ans.
我叫任海镇。
My name is Coraline.
My name is Devi.
C'est l'accompagnement des seniors, à la fois médical, qui prend en compte le suivi des différentes fonctions comme la mobilité, la nutrition, la vue, l'audition, mais surtout l'état psychosocial et la cognition.
हमारा ऐप में आई थी सर्वे थी तो सर्वे टीम माने जाकर थी आई और सर्वे के बारे में पता लागो 来过电话 我挺高兴的，他们来了以后呢，我想这回肯定对老伴儿是吧，护理也好，瞧病也好，有了希望了。完了嘛，咱说呢，完实际完了一个这个这样的那个，完了还在嘛，实际的老师讲，哦，आगे स्वास्थ्य में ठीक रहा।
The ICO program helped us to see a lot of things at one go instead of having to visit the various experts.
J'applique quotidiennement les principes du programme au point de vue nutrition, éducation physique, état social aussi, mes relations avec les autres.
汇报了他们也的确知道是吧？要按时吃药啊，是吧？要活动啊，注意休息啊，是吧？心态要平和呀。
Ce programme va dans le sens qui sera nécessaire dans les années à venir pour que les personnes âgées puissent arriver dans leur vieillesse en meilleure santé. Il y a une population plus autonome plus longtemps.
It will help elderly people who maybe are suffering from little things that they don't realize. And in this way, it is caught.
Grâce à ICOP, je me sens encouragée de continuer dans cette voie pour préserver mon bien-être dans les années à venir.
Okay, so well, to be here in Andorra, no, I think it's important to share this program with the other cities, well, the other, India, China, and France. So I will end and saying that the integrated care for all the people program will permit all the people worldwide to become more robust and more resilient to climate change. Thank you. Special thanks to my team. Thanks.
Thank you, Dr. Eras. Now it's time for David Villanova to do his talk. David is a computational biologist. He has a broad experience in genomics, data analysis. He's now leading the new epidemiologic lab in Andorra Research, promoting research in the health sector and working for the genomics data, the future genomics data.
Thank
Please,
you.
David.
Thank you. Thanks, everybody. Thanks for the invitations. This is a picture from Andorra, actually. So taken from Cortals d'Encamp. So anytime you like to walk around Andorra, you have really beautiful places to visit. And we hope that the planetary health will continue and maintain the sustainability of all this environment. Some definitions to start with, because sometimes people, when we talk about microbiome, we have different ways of approaching this. So the microbiome is these tiny living microorganisms, right? Such as bacteria, fungi, protozoas, or viruses living in our body, but also in the ecosystem. Here I will focus on the human microbiome. So microbes tend to generate biofilms, so what we call a community of microbes that live together on a surface. So this is of relevant clinical importance. The metagenome, when we talk about the metagenome, is that collection of genes and genomes in a sample, whether it's from the human or the environment. And the metagenomics is the study of the genetic material, the genomes from that particular metagenome. Where is the human microbiome? How many do we have? So there's more than 38 trillion microbes in the human body. And the ratio, there's been a lot of debate in the scientific community about what is the ratio of microorganism and in human cells. The latest, I would say, up-to-date community agreement is 1:1. There's more than 10,000 unique species representing more than 8 million genes, and they are broadly located in our body, but mainly in our skin and our gut. So the vast majority reside in the colon, and as I said, it's another layer of complexity that we add to the human body, and we cannot ignore it. Dr. Masip was talking about the longevity, and we know that without the microbiome, we will not be able to live. So there's definitely something in there that should be studied. The evolution of the human microbiome, it's from a while time ago. It's been basically evolving with us since the beginning. It's been there from the beginning. It's impacted by climate changes. For sure, whether you live in different environments do impact the microbiome which resides in that environment and which colonizes and lives in symbiosis with the human body. Obviously, the microbiome is impacted by the habits of the people, the modifications of dietary habits, the exposure to famine, the availability of the food, and so on. It's obviously impacted by the infections, and we know that the microbiome is shaped by our immune system, and so there is a balance that's been evolved during the evolution between our immune system and the bacteria that resides in our body. So most recently impacted by the industrialization, and you will see some examples later. And as I said, the immune system really plays an important role on controlling the microbiota. So why it is so important? First of all, each microbiome is unique. Each person's microbiome is unique. That's something we already know. And as I said before, we cannot live without a microbiome. So the microbiome is involved in many disease processes, here highlighting some of the pathogenic diseases that has been linked to, I would say, dysregulation of the human microbiome. And obviously, there's other factors which contribute to the regulation and balance of the human microbiome. For instance, antibiotics is one of those. And we know it's related to mental diseases as well. There's been some proof already in the community. And obviously, as I said at the beginning, they play a major role in human nutrition. They facilitate the production of vitamins. Vitamin K, for example, is one of those. They participate to the digestion of the food, and so their role is important and basic for our life. How is the human microbiome distributed? Here it's not really entering into detail, but you see that different parts of our body contains different bacteria, and this is mainly driven by the exposure by the skin properties in that particular place. And so, for instance, for example, in the hair, we will find a lot of actinobacteria, but if we look at the stomach, we mainly have proteobacteria. So, and in between, you have a different compositions, microbial compositions, on the skin. So when we're talking about the human microbiome, we're talking about different things. So it's important to always say what are we talking about, what is what we're studying, right? And I think a key message from this is that there is no, I would say, normal human microbiome. It's still yet unidentified. So that's because of the diversity within the body, and because we not necessarily know what's driving, I would say, a safe or a normal microbiome yet. So with aging, and it's been already shown many times, we know that the microbiome changes across the different steps of our life. They're involved, as I said at the beginning, in different, the progression of many diseases, and basically through symbiosis with our human cells, they tend to promote within aging, inflammation, chronic disease, which is something that we need to look into as we are working with aging, right? Today I wanted to briefly discuss and talk about maybe one microbiome which is people are less talking, which is the skin microbiome. The skin microbiome is what we call our second layer on our skin. As I said, it's again individual for all of us, and it's driven mainly by the skin properties. So whether you have an oily skin, moist skin, dry skin, whether you're looking at your feet, vagina microbiota, and so on. So the environment where the bacteria resides, the microbiota resides, drives their diversity. And is what we have seen in the previous slide. And so where are they? Basically hidden bacteria, usually hidden below the epidermis layers, right? And they interact with our immune system. It's balance between our immune system and the presence of bacteria. So they're permanently in balance. And when you have dysbiosis or this is dysregulated, it tends to create problems. Like, for example, I would say psoriasis in skin, or atopic dermatitis, and so on, right? So what drives the microbiome? So there's different factors. So first of all, as I said, the microbiome is seeded at birth. So once the woman delivers, they tend to get in contact with the environmental microbiome, which is normally the vagina microbiome of the mother, and the mother skin, and the mother microbiota. So that's where it starts. It's tolerated by our immune system. Our immune system, through evolution, has adapted and entered a beneficial, I would say, equilibrium between the bacteria, which are considered pathogens for the human, for our immune system. So this training operates through the first month of life, and bacteria colonize the babies, right? Where it grows, it evolves through the through aging, as we said before. it's impacted by many different factors, could be hormonal factors, development changes, climate, food, different factors, and I will describe some here. And obviously, as we age, and this is very astonishing findings from the beginning, our human microbiome tends to be more diverse. We were expecting maybe less diverse, and what we see is exactly the contrary. As people age, maybe because the immune system, we don't know the real causes for that, but clearly there is more diversity as we age. And recently, because Dr. Masi was talking about mice, the effect of drugs in mice, recent papers in mice also suggest that fecal transplantation with mice reverts their aging phenotype. So there is really something in there that needs to be checked. Here are a couple of just pictures I brought from public libraries. So here you see, for example, this is macrophage immune system. This is our immune system, which is entering in contact with bacteria. Here it's actually eating and destroying that bacteria. So when we talk about the microbiome, there is a permanent balance between our immune system and the presence of bacteria. And here you have, this is on plate Staphylococcus aureus, which is a human pathogen that we normally find in skin. Here is another shot from the CDC, here the one I picked up. The biofilms, you see here a clear biofilm. Biofilms are a combination of bacteria that interact to protect themselves from the stress, from the external stress. This is a huge clinical problem because bacteria will tend to put together to defend against external aggressions, like, for example, antibiotics and so on. So the biofilms is really a huge problem for many clinical infections. What is the link between the climate change and the human microbiome? Well, I just put 3 shots because I think it's obvious for everybody that depending on where we live, depending on the properties of the environment, the microbiome of that space is different from one place to another. It's not the same, the microbiota, for example, of the soil in dryness regions, in whether you live in regions with huge humidity or more cold regions. So we know that the microbiome is completely different in these spaces, and that's why I was talking at the beginning. We don't really know what's a healthy or normal microbiome, because you can have people living in all different places, exposed to different environments, and they still live in a healthy manner. So the other big link between the microbiome, and in this case is the gut microbiome, is the diets, the food, the impact of the food. Here are only 2 examples, whether you have a Mediterranean food, or for example, you have vegetarian food. So all this food carries microbes, and those microbes that we ingest interact with our immune system. And so depending on what you have, tell me what you eat, and I will tell you who you are, something like that, right? So this is exact, and obviously the diet is completely different in different places of the world. That's why it's difficult to assess what's a healthy microbiome, because people live healthy whether they live in India, they live in the States, they live in France or Andorra or wherever. So there is no consensus on what's a healthy microbiome. We have a hint on what are the species of bacteria which we believe promote health, but there's still a long way to go.
Sorry, just 1 minute left.
Okay. And finally, the place we live, as I said before, it's not the same living in the countryside or living in the cities for obvious reasons. I remember one study that was done in the metro of New York, in New York, and we see that the number of pathogens that we find in these spaces it's incredibly high, but we still have people that live in those places. So there's some sort of maybe immune balance depending on where you live. And finally, the scientific community will continue to address and understand the link between the human microbiome and the planetary health. Thank you.
Thank you, David. Thank you. Let's move on to the last presentation. Unfortunately, the next speaker could not attend the Congress in person. She's Dr. Cristina Arroyo. She's a doctor, internal medicine specialist in Hospital Nostra Senyora de Meritxell. She's a member of COVID Scientific Committee of the Health Ministry of Andorra and teacher of the Master on Infection Control related to Critical Practice of Universitat de Barcelona. She has kindly shared with us her expertise on antibiotic resistance among planetary health through this video. Please.
Good morning. I would like to thank the organizing committee for having invited me to this interesting roundtable of the first conference of planetary health in Andorra. I'm Cristina Arroyo, infectious disease physician, and today I'm going to present antimicrobial resistance among planetary health. I would like to start presenting this case of an oncology patient with a repeat urine tract infection and antibiotic pressure that presented the following urine culture. As you can see, we obtained this Klebsiella pneumonia with a resistant mechanism, with two resistant mechanisms, one called OXA48 plus an SBL, that shows a very, very limited therapeutic options. Unfortunately, this example is very common in most of the hospitals nowadays. So one of the most worrying aspects worldwide is the increasing of antimicrobial resistance. Antibiotics are molecules that saving millions of lives and revolutionized society and economy, but since their discovery more than 70 years ago, the evolution of the development of these drugs has been marked by the concomitant development of antimicrobial resistance, leading to a decrease in therapeutic options in certain infections, as we saw in the last slide. Today, this inability to treat infections ranks alongside climate change as a global health issue. New classes of antimicrobial drugs are unlikely to become widely available on time soon. Thus, now we are facing a worrying augment of antimicrobial resistance that are causing deaths all over the world. In this recent paper of MRI collaborators, estimators indicate that bacterial MRI is a health problem whose magnitude is at least as large as major disease such as COVID-19, HIV, and malaria, and potential much larger than that. In this same paper, the burden of antimicrobial resistance was estimated almost 5 million of deaths associated with bacterial MRI in 2019, including 1 million of deaths attributable to bacterial MRI. As you can see in this, the first place is in this graphic, with a higher impact in the lower and middle income countries. So 15 years ago, a focal point rested on gram-positive pathogens that were being circulated in hospitals, such as methicillin-resistant Staphylococcus aureus or penicillin-resistant pneumococcus and vancomycin-resistant enterococci. But in recent years, however, the spotlight has shifted to gram-negative pathogens, particularly to multi-drug resistant or extensive drug resistant Enterobacteriaceae. Specifically, over the last 15 years, the extended spectrum beta-lactamases and in the last 10 years, mobile carbapentamases, for example, and the NDM1, have now become globally ubiquitous in the gram-negative pathogens. In this same work, 6 pathogens were each responsible for more than 250,000 deaths associated with MRI, such as E. coli, as you can see, the first of the graphic, followed by Staphylococcus aureus, Klebsiella pneumoniae, Streptococcus pneumoniae, Acinetobacter baumannii, and Pseudomonas aeruginosa by order of number of deaths. Altogether, were responsible for almost 1 million deaths attributable to MRI and 4 million deaths associated with MRI. If we consider the factors associated with MRI, one of the most important associated with the emergency of MRI is the widespread use of antimicrobials. But other contributing factors were the use of antibiotics in veterinary and their addition to the livestock feed, the poor hygiene and lack of sanitation infrastructure to access to safe water. It is estimated that 65% of the domestic and industrial wastewater globally is released into the environment with little or no treatment. And in the same line, the uncontrolled antibiotic usage in low-income countries are other important factor. Lastly, and very important in the last years, is the spread among travelers in tropical regions in the era of globalization, or the spread through the animals. This paper shows the increasing of, in last years, of antibiotic and pesticide usage. The global annual pesticide sales in red increased in the last years, and the introduction of antibiotic classes in blue line, illustrated the progressive adoptions of biocides. So if we consider in this shift towards gram-negative pathogens has changed how we perceive antimicrobial resistance. In particular, many of these enterobacteriae normally resides within the human and animal gut microbiomes, and thus resistant genes and pathogens can be widely disseminated in agriculture and human waste. While long ignored, we now focus on how contaminated drinking water, domestic and industrial waste management, and the usage of antibiotics in animals contribute to the spread of this MRI. For example, the use of colistin in China's and Southeast Asian farms. The emergence of widespread resistance has also forced to consider the One Health approach to understanding MRI and how it spreads across all the community sectors, such hospital communities, for example, and human carriage, or the farming animals, including fish and other animals, vectors, including insects, and of course the animal waste and wastewater systems, and so on. In this figure shows a schematic for complex transmission paths between human and environmental, agriculture, and clinical reservoirs of MRI genes and drug-resistant pathogens. In this recent paper made in France describes the main sources of environmental contamination and contamination routes of soil and water of antibiotic-resistant bacteria. This is an example of high-income countries with MRI and antibiotic residues are mostly human and animal fecal waste inputs. As you can see in the figure on here, we have these waster plants that treats domestic sewage, healthcare facility wastewaters, slaughterhouse wastewaters on manufacturing effluents, for example, and here the livestock effluents with manure that it's uses as a fertilizer. Thus, the potential hotspots are treated wastewater, effluents, fertilizer of human and animal fecal origin, and fish farm effluents. But what is the origin of these resistant genes that causes MRI? This very interesting work of Da Costa in Nature describes that the emergence of antimicrobial resistance predates the modern selective pressure of clinical antibiotic usage, as described in metagenomic study of permafrost sediments, in which they discovered genes encoding resistance to different antibiotics. These studies suggesting that class A beta-lactamases evolved billions of years ago and were transferred into the gram-positive bacteria about 800 million years ago, and that the progenitors of beta-lactamases like CTX-M diverged 200 million to 300 million years ago. That's very, very, very interesting. In last years, the transfer of these predate-resistant genes, mutation of susceptible pathogens, and the selection the selection pressure contributes to the resistant pathogens and their transmission, as you can see in this figure on the bottom of the slide. So the environment contains progenitors of MRI genes from autochthonous bacteria that can transfer resistant genes to humans. Generic scheme for the creation and spread of globally successful antibiotic-resistant clones in all environment, human, animal, and wider environment. There are bacterial variants with resistant plasmids, resistant mutations, and resistant genes, virulent genes, and genes that increase the transmission. The mechanisms, along with selection by use of antibiotics, as we talked before, can select for combinations of these elements in one clone. When a clone arises that combines clinical resistance with high fitness and transmissibility, such a clone can spread through the global and human population and become a dominant and successful clone. A great example of a successful clone is the CTX-M beta-lactamase that encodes SBL, one of resistant mechanisms that we saw in the clinical case in the beginning. That this clone is considered a paradigm in the evolution of the resistant mechanism. The incorporation of different chromosomal BLI CTX-M related genes from different species of Clivera and Enterobacteria has arrived in different CTX-M clusters. This figure of the left shows the hierarchical complexity of CTX-M genes within different genetic structures and bacterial clones participating in mobilization, spread, and maintenance of these genes, leading to a very successful clone, or so-called high-risk clones, as you can see here, with integrons, transposons, and plasmids, and finally with this successful clone. So understanding all factors involved in the formation of transmission of MRI is key to finding solutions. In this work, the authors propose 91 factors into 8 categories, all these factors influencing MRI in Europe's food system that implicate sectors across one half the spectrum. But it's very interesting because they are focused in these different areas, such as environment, governmental, individual, agriculture, trade, innovation, and so on. So how can we tackle this MRI? Speaking in the antibiotic therapy field, the main approaches to reduce the MRI would be the limitation of use of carbapenems. Carbapenems are widely used because are the selected treatment for extended spectrum beta-lactamase, the SBL microorganisms, one of the resistant mechanisms that we saw in the clinical case. And in the last years, they are very overused, and this is likely associated with the development of carbapenem resistance. So the possibility of using carbapenem sparing alternative when treating an infection due to multi-drug is isolate should be considered. Another strategy very important is to limit the spread of antimicrobial resistance, reducing the patient exposures to antibiotics. It's very important in the hospitalized and clinical setting. Another limitation is choosing the empirical and or targeted antibiotic therapy that may lead to reintroduce, for example, of all antibiotics which present efficacy, resistance, and toxicity issues, but can be useful with less resistance in the nowadays. For example, the use again of colistin or the use of new antibiotics and antibiotics combinations that may be promising treatment options, as well the improvement of knowledge in the PKPD strategies. And of course, the investment of development of new antimicrobials. So very quickly, other strategies more focused in One Health and sustainable development goals. This work by Joversen proposed a concept of co-evolutionary governance to navigate towards a more sustainable co-evolutive dynamic between human and culture and the spaces to develop resistance. And another very important and very interesting aspect to the approach is to introduce innovation and digital health for the control of the multi-resistance. So there are several works. I present this very interesting work published in Lancet Infectious Disease, that is the creation of a digital One Health platform that is proposed for online learning. This platform will synthesize the evidence of actions antimicrobial resistant in a fully accessible database, and it's also very interesting for approach of control MRI. So finally, and to summarize, the increase of MRI leads to limited treatment options and is a global health issue. The burden of MRI is associated with a high mortality worldwide. There are different factors related to increase of MRI. Environmental conditions favor the transfer of antibiotic-resistant genes to pathogenic bacterial species. There are different mechanisms to obtain a successful clone that confers resistance. Different approaches are needed for the reduction of MRI, as One Health approach, collaborative governance, innovation, as well as multidisciplinary and governance. An appropriate antibiotic therapy led by a specialist avoiding the indiscriminate use of broad-spectrum antibiotics is crucial for the control of MRI. Thank you very much.
Well, thank you, Cristina. Well, I think we ran out of time, but I'm wondering if the audience has any question for the speakers.
We can have a nice discussion of 10 minutes.
Okay, great. Thank you. Thank you. Is there any question, please?
Thank you. Thank you, Deborah Thompson from One Health Lessons. Quick question about pets and well-being of the elderly and their exercise. So if you walk a dog, you get outside, you experience fresh air. In your studies, in your research, have you been looking at the relationship between the human-animal bond and the amount of physical activity that is involved with taking care of an animal?
Maybe I can answer. Not in our case, not in our study. I think that benefits of having a pet are multiple for the physical and also emotional well-being somehow, and this I think is highly demonstrated. Of course, there are many factors associated with lifestyle that can have an impact, of course. For the other the downside of this is that sometimes the pets cause falls in people that are prone to fall, but I think the benefits overcome, of course, the risks in general. We didn't introduce that, but since we want to push more on the environmental factors and the influence on the physical activity and health benefits, I think we will introduce some of these variables, of course.
Yes, please.
I have a couple of questions if the moderator will allow me.
Yes, please. Go ahead.
Yes? Okay, thank you. First of all, for Dr. Masip, which are the targets that the scientific community are pursuing to get the miracle drug? Are cytokines, pro-inflammatory drugs, or scavengers for free radicals, intermediate telomerase, or epigenetics? And maybe David can also make a comment on that.
Yeah,
where we are.
The answer is yes, 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 and yes. So we're looking at all that. So at this point, this is the early stages of the druggable aging. So we are working on that wheel of 9 factors, and we're I think, as it's been said here today a few times, I mean, aging is a multidisciplinary biological process. So it's very unlikely that one single magical pill is going to just stop it. My guess is that we're going to see a combination of things. The one that is at the forefront right now is what we call the senolytics, which are the drugs that target senescent cells. Those, at the moment, we have first-generation senolytics in clinical trials already, mostly for disease, not for general aging. And it's unlikely that those are going to be the magical cure for all that we're looking in aging. But for instance, that combined with some strategies to sort of replenish the tissues, to recover the regenerative ability of the tissue, that could bring to healthier, younger, more able organs. That perhaps together with something to do with the telomeres, scavengers of oxygen radicals, which on their own haven't been so good lately. That also together with dietary interventions, which is something we're also, it works very well in animals where you go to caloric restriction or intermittent fasting. This is also going to work in humans. I think we're just opening the doors of that field, which is, I'm sure we're going to see striking changes in the next 10, 20 years. And my guess is that's going to be more than one thing that's going to give the answer.
Thank you. The second one is for Dr. Incitari. Have you thinking about to expand your program? Congratulations, by the way, as a Finland manner that they involve municipalities in all those social and healthcare projects?
Definitely, I think it's a great question and suggestion. We think that we have to involve the most broad option or range of actors that we can. And in fact, I always say that a similar program like Agile or whatever, it's an incremental program. So it means that you can go and move on summing up different agents and adding new components. Of course, the involvement of the municipalities and of the local governments and local community actors is key. And in our case, for example, the municipality of Barcelona, which is a broad actor, but also the local services and communities were involved from the beginning. So this is how we could, let's say, fit in and connect the civic center and other community agents. I think that's key, because to have really to activate a broad range of agents in the community. Of course, we can sum up more and more layers. For example, when I presented this to a congress of pharmacists, they propose to have the local pharmacists joining the program, and with the aim of reinforcing our physical activity and exercise and nutrition recommendations. It depends on the public. Everyone comes up with new ideas, and of course, this is a game of connecting agents and creating a governance that works at the local level. I really agree.
Thank you. Is there any other question? No. So I would like to ask David if any one of us in a few years' time will have our microbiome analyzed?
That's a very good question. I think the more it goes, the more genomics will enter in people's life, whether it's by sequencing their microbiome, but also by sequencing their genome, their human genome. We know that because of some, with Illumina is losing their patents. Illumina is one of the big players in the genomics field, and so the cost basically of the sequencing will go down dramatically. So we expect a tsunami of genomic data in the next year, and now the question is what we do with that genomic data. And from a clinical point of view, from the interventions, we know the UK is leading, I would say, worldwide, the use of genomics in clinical practice. And so I guess in the next year, we'll see more and more the use of genomic in the clinical space, but also in other fields that could be nutrition, human nutrition, for instance, the skin microbiome, any other fields. But yes, definitely, and thanks for for the opportunity, but there's going to be a tsunami of data related to genomics in the next years.
I think one of the things regarding what can we do to improve healthy aging from the pharmaceutical point of view, I think the microbiome, it's one of the missing things from those 9 factors because, as you said, it has a huge impact on many diseases and many conditions. And aging, I think, is going to be one of the most important. So the microbiome, the good thing about it is that it's actionable. You can try to modify it. Like you say, the fecal transplant in animals work. So being able to integrate microbiomics into genomics and into healthcare, I think it's one of the pending incoming revolutions, not only in aging, but in many other diseases. I think it's one of the important things for sure.
While you were talking, I wonder if stem cells could somehow cure aging?
Yeah, well, I think it's one of the things. I mean, there's been a flurry of recent papers, at least 2 or 3 from big labs, from Spizo Belmonte in California, from Serrano Lab in Barcelona, showing that reprogramming of cells brings younger tissues. We're playing a bit with fire here because even the things that we do in my lab, and probably many of the things in that circle, stand in the edge of aging and cancer. A lot of the things, and looking from a more evolutionary perspective, a lot of the things that drives aging at the cellular level are the same things that protect us against cancer. So obviously cancer, the anti-cancer mechanisms are there to protect us during our reproductive years. Evolution doesn't act on whatever happens after reproduction, so that's why they don't care that the thing that protects us for the first 30 years is killing us in the next 30 years. So is there a way to disconnect both things? Can you improve aging without increasing cancer? And that's one of the things. And increasing stem cells, the way to generate stem cell or stem cell-like cells and rejuvenate cells, the genes that you introduce, half of them cause cancer. So how can you, is there a way to separate both things? I think it's one of the challenges we have in aging research.
Okay, thank you. Well, thank you, all of you.
Can I just ask a
yes,
quick question? No, because I was curious about the social component of the program. So do you do a specific detection of loneliness?
Yeah.
And besides bringing the people the activities, are there some interventions to reduce this loneliness where the person is home or alone?
Yes.
Because I think that's another important part, no? And it's also a worldwide pandemic somehow.
Yes. When we do the assessment, we include the step 1 and the step 2 of the ICO, but we also include other scales. And one of the scales is related with loneliness. And currently in Escaldes, we are asking for questions related to loneliness. And yes, we are trying to promote some interventions, that could resolve it. And we are working on it with a startup from Barcelona. It's called Vermut App, and this startup proposed many leisure activities. And what we are working with them is to relate the level of loneliness, for example, with different kinds of activities that could, improve the stage. So yes, we have included some scales, not only the ICOP ones, but also others, that are very important. Thank you for the question, Marco.
And if you allow me a quick concluding remark, I mean, we have here the two ends of the story, the clinical end, and we are more on the biological end. But what we're trying to do here to the microbiome, to the genes, trying to prolong life and healthy life, doesn't work if people really don't want to live and don't care about living. So if we say we're going to make you live to 120, and people say, I don't want to live to 120, that's the whole thing defeats the purpose.
Ethics
so I think
will come here
I think that's how we have to balance those two things.
Okay. Okay, so thank you very much.
Don't move.
Okay.
Thank you very much. We have to do very quickly, because we are a little bit on delay, the summary in our tongue language, in Catalan, okay? Gràcies a tots per haver vingut, és un plaer. Ha començat la xerrada el doctor Massip explicant una mica la lluita contra la senescència, contra l'envelliment. És una lluita fascinant. Ara ell mateix explicava com hi ha una línia fina entre l'envelliment i el càncer, d'una manera que hem de procurar investigar com protegir-nos del càncer i a la vegada poder envellir saludablement. És important envellir, però en un planeta saludable. Esperem que puguem envellir i el planeta encara hi sigui, en aquest sentit. Per això estem fent aquestes jornades. He continuat parlant del doctor Marco Incitali, que ha explicat molt bé com estan d'una forma molt més pragmàtica a les poblacions, no tant a la investigació, al laboratori, com fer d'aquest envelliment actiu i com han preparat un programa que es diu Àgil des de fa uns anys a la ciutat de Barcelona i com integren a la població en programes durant 3 mesos, podrien ser més, i que a poc van enfortint els llaços amb aquesta població i veient com també assimilar aplicacions mòbils, digitals, perquè no només quan sigui possible amb els recursos humans oferir aquests serveis, pugui la població també implementar-la per ella mateixa. Després ha continuat la doctora Eva Eras, que està fent una feina molt important aquí a Andorra i treballant amb l'Organització Mundial de la Salut des de fa un temps, implementant el que és un programa que es diu Intrinsic Capacity for Older People, la capacitat intrínseca de la gent gran, i està fent un pilot que va iniciar aquí primer a Canillo, va continuar a Escaldes, a Sant Julià, a Escaldes, i també aquest pilot l'està fent juntament amb Xina i França, vull dir, Andorra, Xina i França, i és una cosa interessantíssima i que donarà resultats en breu en aquest sentit. Felicitem a la doctora Eras per tota aquesta feina. I després també el David ens ha explicat el que és el microbioma, el microbioma que a vegades la terminologia és important, el biofilm, el microbioma, on estan... I sobretot 2 o 3 conceptes. No hi ha cap microbioma estàndard, tots són, diguéssim, una mica diferents, i és important saber que la gent que viu a zones remotes té una més varietat important de microbioma que no pas la gent que viu a grans ciutats o que estem exposats a molts més impactes en aquest sentit, que poden ser bons o poden ser dolents i poden canviar en això. Fa falta molta investigació i, com comentaven entre ells, doctor Massip i el doctor Vilanova, el microbioma pot ser també un factor important a estudiar i, com ara comentava el doctor Vilanova, la informació genètica serà abismal en poc temps i tindrem molta més informació en aquest sentit. La doctora Royo, que no ha pogut assistir avui, però ens ha deixat un vídeo molt preciós, ha explicat la relació entre l'antibiòtico-resistència, el medi ambient i inclús alguns camins, pathways, de relació entre el que és les males pràctiques, si no hi ha un bon control mediambiental, i com això podria propiciar que la resistència passés a bactèries realment patògenes en aquest sentit. Superinteressant, i també el camp aquest és fascinant, i el canvi climàtic, els factors estressants també variaran tot aquest tipus de resistència. Moltíssimes gràcies a vosaltres, ha estat un plaer i molt bona moderació, doctora Boada, i en aquest sentit, amb preguntes relacionades amb els diferents doctors. Aquí tornem i, Laura?
Yes, let's do now a short break until 11:40, and then we continue with the last roundtable.
11:40.
11:40?
Yes,
11:40.
Because we are 10 minutes late. Yes, only 11:40, yeah? No later. Thank you.
See you then.
sommes très fiers en Andorre d'organiser ces premières journées de santé planétaire parce que nous sommes conscients de ce que la santé et la planète peuvent avoir de commun. Il s'agit de savoir d'un côté en quoi les souffrances planétaires, entendues comme écologiques, peuvent toucher la santé des hommes et en quoi les habitudes des hommes peuvent affecter justement ceci, l'écologie et toutes les, disons, les attributions que notre planète, entendue comme écosystème, peut avoir sur la santé. Alors, c'est véritablement, nous pensons, et c'est pourquoi nous en sommes fiers, une innovation que de rapprocher ces deux disciplines qui sont à la mode, hélas, pourrait-on dire. Et donc, ça sera notre première occasion d'accueillir ici de très grands conférenciers qui font autorité en la matière, que nous allons écouter avec attention et que tous les assistants et que tout le public va devoir suivre s'ils veulent respecter à la fois leur santé et à la fois notre planète.
Hi, Jordi. Thank you very much. That's a pleasure to be here in Andorra in this very important activity. Yes, planetary health, for those like me that is in the field for some decades, it's an interesting concept because we start as environmental health early in the 90s, 70s, so discussing in Stockholm all that relationship between environment and people, and very much focus on the media, air, soil, water, and that's all important today, yeah, but it was kind of segmented, and that's come together in explaining the relationship between environment and health, and the environment epidemiology then was a very important concept, and everybody, you know, dedicate ourselves to environment epidemiology, environmental toxicology, and also the science of exposure was a big, you know, community working and discussing it, and that is have an evolution to talk about determinants of environmental health, determinants of health, and then from there there are this new concept that is very interesting, planetary health, where not only you look into the same very important issues, that the interaction between media and people, but a little bit broader. You look for the interaction between humans and the earth, and how that is happening, and also how that distribution is socially fair or unfair. And this is, I think, is the very interesting advancement in this concept of planetary health, different from what we had before, because it's a more holistic view and more focus on the planet, people, and the equity. So that's all the same time, and this is an exciting time, where, you know, after the publishing of the Lancet Commission on Planetary Health and all this big community that is actually evolving and forming, and also trying to perfect the concept itself, because it's a concept that in principle looking to go a little bit more focus on Earth system and Anthropocene era, but actually we end up being more anthropogenic and very much looking in the humans' health and very focused on humans. So, and I think the community is now advancing and discussing more and more this interrelationship, this integration, and that's why such meeting like this one in Doha is so important, not only for review where we are, but also to address and discuss how to challenge it and advance knowledge in this very important new field of public health and global health, of course. Thank you.
So thank you very much on behalf of the Barcelona Institute for Global Health, is global. Its trustees, institution, and the whole is global community, to the authorities of Andorra for this kind invitation to participate to this international conference on planetary health that comes at a very important moment. In an intense and closely interconnected, permanently changing world, all health is global and therefore needs to be understood beyond geographic and political boundaries. And also, health needs to be promoted and protected as a global public good. So it's global as an academic research and translation institute, has been a pioneering center in promoting the concept of planetary health as a new way of thinking about and researching health in the context of the Anthropocene. Since this new concept gained visibility a few years ago, Global has promoted its adoption as a cross-cutting approach that requires understanding complexity, working in a multi and interdisciplinary way, and also, importantly, acting urgently. Our commitment to combine human health with the concept of the health of the Earth's natural systems coincides with some of the formulations both of the United Nations and of prestigious academic institutions and different fora all over the world. For its global, our main challenge is how to improve health and human development and at the same time reduce the enormous health inequalities, in other words, the unacceptable lottery of where you are born and raised. And this challenge becomes concrete with our commitment around the Sustainable Development Goals and the relevance of the climate crisis and the Anthropocene as a unique opportunity for transformative changes to precisely improve health and equity. We work on two main fronts: combating diseases related to poverty and improving equity in health and development, and also in promoting healthy environmental conditions, especially in cities. And in both areas, with these both approaches, we combine human health and environmental sustainability as key components. And I have to say that the current pandemic, COVID pandemic, should accelerate precisely the understanding, the importance and the scope of this idea of planetary health. Obviously, this poses enormous challenges, both challenges for the imagination and the way of thinking about health, but also challenge of transformation, of policies, of action, and especially of urgent action. So in closing, we are very happy to do our bit to contribute from our knowledge generation, dissemination and application activities to tackle these challenges, and also to be part of this outstanding event today in partnership with prestigious and committed institutions and colleagues. And also we remain open to find new ways to align new opportunities to formalize our mutual collaboration with Andorra, as we have done in the recent past around the COVID-19 pandemic. Thank you very much for the opportunity and all the best for the conference.
The health of humans and ecosystems are more and more intertwined. Planetary health is an emerging discipline which covers the linkage of those concepts. Facing these new changes, we will need to adapt and transform our healthcare systems, and also it will be necessary to work together with scientists and researchers from the disciplines related with ecosystems. The coming Planetary Health Conference, to be held next 12 and 13 of May in Andorra, will cover some of those aspects. Please join us.
Older people are vulnerable to the effects of climate change, like extreme heat, air and water pollution. Given this situation, a healthy aging can enable all the people to be more resilient to cope with the changes. At the next international conference, Planetary Health, we will explain the Andorran healthcare program to promote a healthy aging.
In the Planetary Health Conference, we will talk about the microbiome, its interaction with the ecosystem, and its impact on the human health.
Els propers dies 12 i 13 de maig tindran lloc a Sant Julià de Lòria la jornada sobre salut planetària. Intervindran institucions andorranes i també de caire internacional, com per exemple l'Organització Mundial de la Salut. No us ho podeu perdre.
From the point of view of public health, Planetary Health offers many opportunities and challenges. Public Health Agency of Catalonia is involved in different initiatives. I would like to highlight the identification of environmental risks to health, the evaluation risk with risk assessment strategies, and actions to promote the reduction of this risk. It's a pleasure to see how this interdisciplinary field, the planetary health, includes health people with this important concept.
Human health and environmental health are two main topics that scientific community have been dealing the last years. However, the intersection between these two dimensions is still not deep explored, and this is a great challenge that we have in the coming years, and after pandemia is of course one topic that has been put in front of our priorities. The International Conference on Planetary Health is a great opportunity that we have to join the cutting-edge community dealing with this topic. So we're really welcome to host you here and have the opportunity to discuss this amazing topic with us.
Well, planetary health is a new paradigm that has arisen in the last years, and basically it refers to the importance of understanding that human health cannot be separate from the health of natural systems. Basically, in the last decades, the improvements in global health have been sustained by an overexploitation of natural systems. We've seen in the last decades how life expectancy has improved, under 5 mortality has decreased, but on the other hand, during this same period, we've seen an overexploitation, as I said, of the ecosystems. We've reached a point in which we have to change our definition of health and understand that health has to be understood as a global concept, and human health cannot be separate from the health of the natural systems. And this is especially important, as I said, in this point in time where we are facing the climate crisis and the global environmental crisis.
Es va casar amb la mare de les
Kardashian.
I llavors va passar a ser un personatge molt públic.
Vale.
El show aquest del
Sí,
Kardashian,
sí.
i una persona molt coneguda ja. I ell s'anava posant rímel, ara no sé què, fins al moment que es separa de la dona i diu, és que jo vull ser dona. I avui en dia és una dona més dona que tu.
Ja. No, jo del col·lectiu trans he fet moltes coses aquí perquè trobava que era un àmbit que no se'n parlava. I amb la tele em vaig fer amb l'associació, amb Diversant, em porto molt bé amb la seva presidenta, i vam començar a fer reportatges i vaig guanyar un premi per un reportatge. Si t'interessa el tema ja te'l passo, perquè aquest és pel Dia de la Visibilització LGTBI.
Tinc converses de gent. Hi ha micros oberts. No sé, hi ha micros oberts. M'estic sentint jo a mi mateix. M'estic sentint jo.
Sí, ya en micro aquí.
Mutea todo. Todo fuera, todo fuera.
Menos el vídeo.
Todo fuera, todo. Máster fuera. Todo fuera.
Now that we are seeing the war in Ukraine, the danger of nuclear war is rapidly increasing. In the Cold War, the concept of MAT, mutually assured destruction, prevent the world from being destroyed, because nobody thought that a nuclear war could be winnable. That's a reality we face now. No nuclear war could be winnable, and it is highly unlikely that human species could survive a nuclear winter due to a nuclear war.
Welcome to the International Planetary Health Conference in Andorra. On this conference, we will focus on different topics. The first one will be the lessons learned on the pandemic and how to address planetary health challenges with them. We will continue with the environmental impacts in our health. Believe it or not, it really affects our health. We will then follow up with the open era for digital health and how can digital health help planetary health. We will continue with the healthy population concepts. We want to maintain our population healthy, how we can do that. And finally, we will focus on the bioindicators and social and economical indicators that have to do with the planetary health concept. Don't miss our conference. We will be here in Andorra, but with connections from all around the world. We are so happy and very glad and very thankful also to have speakers from the World Health Organization, from the International Migrant Organization, from UNICEF, from the IS Global Barcelona Institute for Global Health, from Instituto Carlos III from Madrid, from the Summer Public Health School of Menorca, from many other institutions around the world. We will bring all these speakers together to discuss the concept of planetary health and how we can secure our future together. Stay tuned, do not miss our conference. Stay with us in the International Planetary Health Conference of Andorra.
Les personnes âgées sont plus vulnérables aux effets du changement climatique, tels que la chaleur extrême, la pollution de l'air et de l'eau. Face à cette situation, vieillir en bonne santé peut rendre les personnes âgées plus résilientes pour faire face à ces changements. Lors de la prochaine conférence internationale sur la santé planétaire, nous expliquerons le programme de soins de santé de l'Andorre pour promouvoir un vieillissement en bonne santé.
Welcome everybody back to the conferences after this short break. Now we have the last roundtable that will focus on research in biodiversity and also social and economical indicators. From the Amazon to the forest of Andorra, this talk will discuss about the importance of maintaining the richest possible biodiversity and also strong social indicators to achieve the healthiest planet possible. In this occasion, we are pleased to welcome Christian Gollier, the President of the European Association of Environmental and Resource Economists, Carlon van der Laat from the International Organization for Migration, Javier Balbuena from the Pondera Healthcare Foundation, Oscar Chamat from Metropolis, Dr. Guzman Bernabeu from Franklin Tello Hospital from Ecuador, and Dr. Roderick Gigot from the Center for Genomic Regulation.
Thank you very much, Laura. As always, for the new people, let's launch the video to remind what are we talking about. We're talking about biodiversity and how we can do for not losing more biodiversity, migration and health, isolated remote areas, how they are tackling healthcare. We will have a video from the remote areas of the Amazon. We'll have somebody talking about the Planetary Health Research Center in the Amazon. We'll have another speaker talking about big metropolis. And finally, also we'll have the research in genomics in that sense for the biodiversity. It's a fascinating talk. We give you the floor. Vanessa, thank you very much. And Vanessa Arroyo from Foundation Research and Innovation of Andorra will be leading the talk. Thank you, Vanessa.
Roundtable today, the fifth roundtable of the conference. Welcome everybody, and welcome especially to our panelists. This roundtable is going to be very innovative because we are going to make a travel all together. We are going to go from Andorra to visit Amazonia, Ecuador, Washington, landing in Toulouse, Barcelona, and finally going back to Andorra, where we are going to be able to address some questions to all the speakers. And during this trip, we are going to be able to understand better how new technologies are impacting in the knowledge of biodiversity and how the genomics are contributing on this. Also, how strong indicators are really needed to, for a better understanding of the impact of planetary health in order of take decisions in society and economics areas, and how we can achieve the highest status of health, but not only from the point of view of human being, but also for all the species that are also living with us in our ecosystems. So finally, we will focus on different approaches, how planetary health give different challenges in comparison if you live in the middle of Amazonias or you are living in a really polluted metropolis and so on. So thank you very much. We are going to start with Mr. Christian Gollier. He is online. He's a researcher and governmental advisor that has published more than 100 articles in international scientific journals and has books on the economics of uncertainty, some of them having received prizes. In addition to his activities as an internationally recognized researcher, Christian Gollier has rich experience in teaching around the world. He held a visiting professorship in the Department of Economics at Columbia University during the entire 2015-2016 academic year. So the floor is yours, Mr. Gollier. Thank you very much.
Thank you very much. Thank you for the invitation. I'm an economist, as you understand now, and I'm interested in trying to help decision makers to shape policies that are compatible with the common good. That's particularly interesting and important in the domain of climate change and health economist. I'm not a health economist, but I've been working on COVID economics over the last 3 years. I also am very much involved in the debate on carbon pricing, how to induce our current generation to organize the investment and the set of efforts and actions that are compatible with our responsibility toward future generation. I would like to talk today about, I think, an important topic in relation to the issue of how we value extra financial, extra monetary impacts of our decision. And in the domain of biodiversity, in the domain of climate change, it's extremely important when we determine what to do now for the future, for the benefits of future generation. How do we value those things, those non-monetary impacts? I would like to take the COVID pandemic that we faced over the last 2.5 years as a case study of what should be done when we think, at least as an economist, when we think about how things should be done and how we could organize a cost-benefit analysis when you have different dimensions of the impact: health impact, monetary impact, biodiversity impact, environmental impact. So, a particularly important domain of absence of consensus when we think about preservation of biodiversity or investing to reduce mortality risk is how do we value the health impact of our efforts to improve the future. And again, in this, all around the world over the last 2 years and more, we have seen a debate not clearly expressed about the relative weight of importance of health impact and monetary impact in the question about how much we should invest in limiting the risk of dying from the COVID. We know that in particular early in the pandemic, the only way to save life was to organize lockdown, and lockdown has a critically important impact on the economy, that is on purchasing power, on the ability of people to create values and consume. And so this trade-off between saving life and saving the economy has been particularly important in the public debate over the last 2 years. In particular, I mean, the question of should we flatten the curve, to take again the terminology of the time, that is control the pandemic, not crushing the curve, that is not going to make sure that nobody die or a very limited number of people die from the COVID by imposing a terrible lockdown. I mean, this zero COVID strategy that indeed save a lot of lives, but at the same time is quite catastrophic in terms of the ability of people and the economy to create values and purchasing power for the people. We as economists, exactly as what we did as climate economists 30 years ago, we use models from hard sciences, in the case of climate change, climatology, and in the case of COVID epidemiological models. So we economists, we have been using that kind of models, adding an economic module in order to try to estimate the impacts of different policies in relation to the common good, the social welfare, and trying to determine what's the quote-unquote optimal strategy that minimize the total costs for the economy of a specific event like climate change of the COVID crisis. And clearly in the two dimensions, climate change and COVID, there is one critically important dimension, which is uncertainty. I mean, keep in mind in February, March 2020, we had no idea of what was the mortality risk of the COVID, what was the R0, the contagious of the virus, what would be the time necessary to develop vaccines. At that time, we had critically important uncertainties, and that's those uncertainties play an important role in shaping public policies in different countries around the world. And one issue was that, in this pandemic politics, the issue of, as long as you do not value things, in particular extra financial impacts like health impact or impact on biodiversity, it's extremely difficult to organize a public debate and helping policymakers in their decision to organize the best trade-off between, in this case, saving lives and saving the economy. Some politicians said we should save life whatever it takes, to coin a traditional term now. And whatever it takes does not make much sense, but because at the end of the day, we need to put a value on life, in particular on life saved, in order to determine what is the best social compromise between the different contradictory objectives we face. And this inability to speak about the value of life has been catastrophic, in particular in Europe. In the public debate, creating a lot of frustration about when we are in lockdown, when we were under a lockdown status, we should get away from the lockdown as soon as possible, even if it costs life, in order to save the economy. And when we're back to normal life, people said, well, we do not save enough life, we should go back to a lockdown. The absence of putting a value on extra financial impacts has been a problem. And keep in mind that people themselves are not ready to do whatever it takes for them to reduce their mortality risk, and that should be translated into the shaping of policy evaluation when we think about climate change, biodiversity, and in this case, COVID-19. So this issue of responsible behavior at the global level and at the individual level has been an important element in the debate. Keep in mind again in the COVID-19, this question about whether we should do social distancing, self-quarantine, whether we should use the vaccine or not. The difficulty is, should we just count on the willingness of people, the voluntarism of the people to do in their own life what is desirable at the collective level? We know the answer is not. Because when you protect yourself, in fact, you protect the others. When you vaccine yourself, you also reduce the speed of propagation of the pandemic in the whole population. And so the fact that you do not necessarily get the incentive to take into account of the social benefits of your own action imply that you do not invest enough in protecting yourself and therefore in protecting the others. So we have a positive health externality, and it's very similar to climate change. When you reduce your emissions of CO2, you bear the cost of this effort, but you do not necessarily get the incentive to take into account of all the global societal benefits of your efforts. And that imply again that there is the laissez-faire solution provide not enough protection for the civilization, for the society as a whole, and that implies that we need, and it's obviously clear in this conference, we need to shape public policies that make sure that we align the private interest on the common good. Another example is the consequence of catastrophic anti-vax movement in Europe and in other places in the US too. The fact that we have these peoples that are not ready to get the vaccine, that also generates externalities. Those people do not take into account of those negative externalities, and that has a social cost. And then there is the question of how do we organize the society as a whole to make sure that all people are mobilized to contribute to the common good. One possibility is to value pro-social behavior to fight the free riding problem that I just mentioned. That's difficult. I mean, if I put a parallel again with climate change, there is this issue in climate change of putting a price on carbon in order to penalize the people who are not ready to take into account the social benefit of reducing their emission. The same problem arises.
Mr. Golier, 1 minute, please.
Yeah, sure.
Sorry.
Thank you very much.
Thank you.
I only one small comment after this slide. So there is this issue of how do we collectively manage this collective risk in Europe. The solution has been to penalize non-vaccinated people. I'm not completely sure that's the right way to proceed here. One last comment for the last minute that I have. When we think about all those preventive efforts to reduce risk, in particular collective risk, and the case of investing in intensive care units in the face of the future, the face of the next pandemics, we do not take into account in the evaluation of those policies that investing in those preventive assets are particularly valuable in the case where the society is in a catastrophic state, and therefore those investments have an insurance value, have an insurance benefits. And therefore, when we just value the cost and the benefits using expected cost and expected benefits, we just miss the very important benefits of those preventive investments, which come from the insurance benefits of those investments. And that's true for intensive care units in the face of the next pandemic. It's also true for the protection of the biodiversity. The consequence of the current methodology used around the world by the World Bank, by most governments, just to compare the expected cost with the expected benefits of a preventive action, imply that we do not make enough collective investment in preventive activities. Thank you very much.
Thank you very much. Yes, something happened with the slides, but we will be able to share them later, so don't worry about this. And thank you. Now we are going to introduce Mr. Carlos van der Laat. Yes, he is the Migrant Health Senior Program Global Coordinator on Health Promotion based at IOM headquarters in Geneva, Switzerland. He has a medical and public health background as a family and community physician and a master's degree in human rights. His expertise includes community-based services with an intercultural approach to provide access to vulnerable populations to health care. And he has been a consultant for World Health Organization and UNICEF based in Costa Rica. Mr. van der Laat, the floor is yours. Thanks.
Thank you very much. Yes, thank you very much for the invitation. I mean, really nice experience. Very good knowledge exchange. Very nice people. Beautiful place. So I really can't ask for more. Really great experience. Thank you very much. So it's a big pleasure to be here, and a great honor also to be part of this panel. And yes, I changed the name of the presentation. So now I'm going to focus in mobility-sensitive planetary health. You know, to try to broaden the perspective of how we approach planetary health. Always talking about inclusion, because this is the important part of the whole system, to include all populations. So I will start by creating some conflict This could probably cost me my job and could probably create some interagency discussion. But this is basically how we show the environment impact on our health. This has been shown on several presentations, and it is very nice. You know, you can see it includes occupational health, includes air pollution, includes climate change, and you see this and you, oh, it's so nice, so well drawn. You know, it's a very nice slide. But there's a big gap there, and it's basically that people move. Okay, so we need to consider that. You know, people really move. And that's a reality. So the real context always includes mobility. We are not static. Human beings and also animals move. We transfer to other places. People always try to improve their current life conditions. And migration is how they are able to survive sometimes, how they are able to do it, to improve their normal life, to improve their health also, and to offer a better life also for their loved ones. So I will focus basically in two main messages, two very important approaches which need to be always considered when we talk about planetary health, when we discuss One Health, when we talk about climate change, when we develop proposals, when we plan for the future. These important approaches are inclusiveness and mobility-sensitive approach. Okay? I will talk about inclusiveness, and I will use COVID-19, which has been definitely the big school for inclusion. If we really want to see the whole picture, to understand where we are in terms of planetary health, to know how to move forward, if we want to really, we really need to carefully review the lessons learned and build a more inclusive health system. So we all remember that. I mean, basically, the virus appears 2 years ago, more or less. Initially, we thought it would be just a challenging time for the health sector, you know, affecting mainly people with pre-existing conditions. And we said, this will be easy. We thought that by strengthening health systems, we would be ready to face it, and that those countries with strong health systems were going to beat the virus very easily. You know, you all remember that moment in time, you know, when we thought it was going to be easy. It's just the flu, you know. But what happened? Well, basically, no, we began to hear other voices, sometimes too many voices, sometimes very high-level voices, and we saw that the issue was highly political, revealing in some countries also big gaps with missing or weak public health policies. We also started to see the importance of human behavior and personal perception to health. So people totally denying the existence of the virus, or shouting for freedom, or avoiding quarantine, or the use of masks. And we all saw that. And then we understood also the link of the disease with socioeconomic conditions, bad sanitation, risky home conditions. All that was happening, you know, in a very complex situation. And then all the hidden truth came also to surface. All systematic inequalities, structural barriers based on race and ethnicity, all inequalities were also now visible. And finally, the virus also revealed the enormous weight of human mobility, for good and for bad. It made us think about borders, which were able basically to delay the arrival of the virus, but were not able to avoid the entry of the virus. And we realized, you know, the enormous cost of closing borders and the enormous human cost also associated with confinement. So this is a very, very challenging situation, yes, but also a lot of lessons to learn. This is a great example of planetary health in action, the interaction between animals and humans, the heavy weight of human behavior, the challenges with the existing structural barriers and the inequalities, the impact of the environment, the urgent need of precise cross-border data. And yes, definitely the enormous need also to recognize that without inclusion, we will never move forward as a society. So now we are also changing. You know, the SDGs, we always talk about leave no one behind. This has been like the big thing, the big issue, the big topic. But now things are changing. I now think that it's not necessarily about leaving no one behind. It is basically that if someone is left behind, no one will move forward, basically. I mean, as a society, and COVID showed that, you know, it's not about me and my house and my community. No, it's about a world, you know, it's about a planet. So that's why we talk about planetary health. And yes, basically this is the goal of planetary health. We really need to use a more inclusive narrative. So health by itself is an inclusive concept. There is no planetary health without inclusion of all populations into our plans. There is no public health without inclusion. I mean, I really can't do health promotion. It's not possible to do prevention without inclusion. It's not possible to do surveillance without inclusion of all populations. And there is no possible risk communication or without including other groups. So although planetary health is broad, yes, we always need to be also people-centered. And this is also an important message that we need that I wanted to bring today, meaning that it's inclusive and participatory, meaning that needs to consider, to engage, to ensure participation of individuals and communities in defining their needs, vulnerabilities, capacities, making them part of the process and part of the solution. So that's what usually you can hear in the field, you know, nothing for us without us. We really need to think about inclusion as an important component. So yes, people move. In real context, people on the move are part of our community, and is in every country, in every health system, people move, we move also. And the health of people who move should also be part of the response of the health system. It's not about solidarity. It's not because we are so good, we're so nice, we're receiving these refugees, we're receiving migrants. No, it's because it's our responsibility also as health system, you know, to include populations and to work in a public health perspective, and that is the reality. So we always work with health authorities and governments, but considering the needs of the population. And here you have some numbers. I mean, basically, even during the year of the lockdowns, 2020, conflict and disasters triggered 40 million new internal displacements. So even though we were there in our apartments with the doors closed, the world still was with war, and there was hunger, and there was displacement, and there was a lot of situations happening. If no action is done to 2050, basically 216 million people could move because of climate change impacts. So this is very important. And I wanted to bring this map also, because we have been seeing several maps, and when we talk about planetary health, we should always try to do these types of maps. We shouldn't use national only maps, because that's not true for planetary health. If we're talking about planetary health, we talk about regions, we talk about borders, we talk about routes, you know. So it is very important also to include this. And here you can see as an example, this is an example and basically with displacement, when there is conflict, it's easy to monitor, to register those populations. But what happens when we talk about climate change? What happens when there is a dry corridor? This is like a very, very, very slow, you know, it's like a drop by drop. It's like a slow condition that creates also a lot of movement. So people are migrating from areas basically because of droughts, because of sea level rise, because of floods, while affecting also the agricultural sector. And this is quickly in Central America. You know, we used to talk a lot about Central America, and we say, oh, these groups, these caravanas going north, you know, because of insecurity. But have we really looked at this phenomenon with the planetary health vision in terms of what has been happening in terms of climate change? And look, that is the dry corridor. And basically, these are people who were used to have their seeds and their plantations, and now everything is dry. You know, so basically, my only way to survive is to go to the city, to migrate to the city. And this is also a very important drop-by-drop, slow onset phenomenon caused by the climate change that we need to review. I was recently in Tenerife. We have there, the Spanish government, we're supporting the Spanish government with a shelter for migrants. And I was able to see pictures of how fields were in Senegal, in West Africa, 10, 15 years ago. And to hear the migrants there showing you the new reality of dry spaces, and basically saying my only way to survive is to take this boat and go to Europe, you know, because basically my food sources are totally gone by now. And this is exactly what we want to see. I mean, this is exactly what is happening in the world, and the invitation also to include in our planetary health narrative, to include the environmental migrants. It's very, very important because it's also very, very linked to what we do. Here are some recommendations. Basically, migrants might continue to be excluded from social and health services, so we need to include them. It is urgent to implement also long-term solutions for internal migrants through the development of migrant inclusive policies and their inclusion in national health coverage plans. Not just to bring them some health now, no, it's to include them and to allow them to be insured and to allow them to be part of the social security system, etc. We need to make sure that people move in safety and with safety and dignity, including also in times of crisis, and do not remain trapped in dangerous or degraded environments. We need also to ensure migration and health considerations are addressed in climate and planetary health. So that's why I'm here, because I want all of you to remember that. We need to include migration, mobility-sensitive approach in all of what we do. And we need also policy coherence. Sometimes we see a very nice health policy, a very nice migration policy, but we need really to have them linked, to have a coherence, and to really use them to improve the conditions of human beings. And we need, yesterday we saw really great presentations. We need better data. We need innovation. We need better ways to gather data, to monitor that flow, to stop thinking only in our national context. No, think about a regional context. Think about these groups of people moving from one side to the other in our borders. And finally, we need to share information, to share best practices, to work together. So here is just to show, in IOM we are doing a lot of guidelines and a lot of resources, a lot of documents on climate change that you can look in these two repositories. One is specific for environmental migration portal, and the other one is the migration health research portal, where we do have a lot of documents that could be useful for your projects. Okay. And that's it. I don't know. Thank you very much.
Thank you very much. Thank you very much, Carlos. So we continue now with Dr. Francisco Javier Balbuena. He is a health manager with more than 15 years of experience, a member of CEDISA, president of the Pondera Foundation, and vice president of the Foundation for the Development of Oncology. He is an alumnus of the National School of Health in his master's degree in health management and MBA from the University of Barcelona and the EAE. Dr. Javier Balbuena, the floor is yours. Thank you very much.
Bon dia. Good morning. It's an honor to be part of this roundtable. Mountains have always been my great passion, and that's why Andorra feels like home to me. When I was 10, I loved it to get in the forest and let hours go by while I was watching the ecosystem. I was lucky still to be able to have my walks in the nature alone. As a teenager, I founded one of the first ecological social movements in my hometown. At the moment, I was involved in the beginning of social activism against poverty. I put my efforts in those countries most affected by extreme poverty. As you can see, I have been linked to human development and environmental preservation since I was only 16 years old. People and environment are two sides of the same coin. Years went by, and I developed my professional career in health management, where I spent the last 70 years. Between my tasks, I've been directing hospitals and other health institutions. The result of the merger of these three areas of interest is the Pondera Foundation. This foundation, which was created in 2018, has a mission to support well-balanced functioning of any institution in the field of health management, especially in vulnerable territories from an economics, environmental, or social point of view. Today, we work in Cameroon, the Democratic Republic of Congo, Ethiopia, Peru, and Ecuador, making possible the health care for 13 million people, always from the perspective of planetary health. We are fully aligned with the ideas of the United Nations Framework Convention of Climate Change, with a focus on not only on the people, but also on the social, culture, and economic condition and its direct relationship with the health of planet. Okay. Collaborative work is a priority for us. Therefore, in order to achieve our goals, we need collaboration with other institutions. For this reason, we established relationships with a considerable number of entities. Do you remember that boy who went into the forest? Well, one of the things I enjoyed the most while I was in the forest was to observe the interaction between different animals and plants. For example, I was really curious to contemplate a fox hunting a bird. Today, we have come in this mountainous country to present our flagship project of the Pondera Foundation, the Planetary Health Research Center Manuela Munarriz. This Research and Development Center is going to lead the implementation of planetary health in one of the most significant territories of Earth, the Amazonia. We have a huge experience in the territory. With an important link with the different ethnic groups and cultures of the area, many of them recently contacted people. There are also several groups in the territory that are still in voluntary isolation. Our main objective is to be a world reference center in the development and research in planetary health, always keeping in mind working from the absolutely care of the environment in which we find ourselves. Our mission is clear. We want to become a hub in order to improve human health, the health of the planet, and to boost a new economy. Our goal is based on the collaborative spirit that I spoke about earlier. Nuevo Rocafuerte, the place where the Planetary Health Research Center is going to be located, is a town of 300 inhabitants, founded in 1945, that offers us the following possibilities: not to violate the environment with a new human settlement, provide healthcare and personal safety for our researchers, accessibility due to the availability of easy river access and an aircraft runway. As you can see, everything comes with a good dose of adrenaline and adventure. If it wasn't, it wouldn't be fun. We cannot forget that the experience will be wrapped in a life lesson in paradise. The researchers and their teams will be working one of the centers with the most biodiversity of the world. Planetary Health Research Center Manuel Munarriz is located in one of the 5 places on Earth with mega biodiversity, at the confluence of 3 important Amazonian rivers, and at the link between a biosphere reserve and national park, Yasuni, and Nature Reserve Cuyabeno, with the aim of guaranteeing our minimum footprint on the environment. The Technological Institute of Construction, a Spanish foundation specialized in incorporating circular economy criteria into projects and works to reduce environment impact, will collaborate with us in all phases of the draft. The work is on the way. In the next few days, we will present the business plan to the partners, and behind the architectural design phase. Very soon, in January 2024, we will have the first researchers at the Planetary Health Research Center ready to provide concrete measures to improve planetary health. I take this opportunity to make an appeal to partners interested in participating in this research hub, universities, public institutions, companies, or foundations. There is still time to join the social innovation for the planet. In love with the environment, health, and people. See you in the jungle.
Thank you very much. Thank you very much, Javier. Perfect. Now is the turn of Dr. Oscar Chamat, who is a civil engineer from the National University of Colombia and holds postgraduate and a master's in urban and territorial development. He has been working in urban innovation for the past 20 years, first at the local level with the City Council of Barcelona, designing the city bike lane network, and then internationally as a head of the Latin American market for the Smart City Expo. Today, Oscar works as a policy and research officer at Metropolis, the Global Association of Metropolitan Spaces. In Metropolis, he coordinates, among others, the initiative Cities for Global Health and the collaborative project Emergency Governance initiative focused on the metropolitan governance of emergencies, a project co-led with the London School of Economics and United Cities and Local Governments. If I understood well, we have a video of Mr. Guzman. So,
Hello, I'm Guzman Bernabeu. I am the director of Hospital Franklin Tello. I am speaking from 0.9 south latitude, 75 west longitude in the Ecuadorian Amazon on the border with Peru. For almost 60 years, the Franklin Tello Hospital has accompanied the communities on the banks of the Napo River, made up by the indigenous Quichuas, Guaranis, Sequoias, for the most part, along with the mestizos. The only possible access is through the majestic Napo, which, like the jungle, gives identity to his inhabitants. We are the only hospital 300 kilometers upstream and downstream. The Capuchin mission of the Apostolic Vicariate of Aguarico serves these small communities scattered along the riverbank with its missionaries. The alliance with the Ministry of Health of Ecuador allows actions in an area that would otherwise be neglected. On the other hand, there is another characteristic that makes the Franklin Tello Hospital a benchmark over by nationality. We receive patients from both sides of the border. The 40% of the pathology treated is exotic. Malaria, dengue, leishmaniasis, Chagas, intestinal parasites, cysticercosis, paragoniasis, snake bites, and the rest cosmopolitan. Diabetes, hypertension, common respiratory infections, trauma, obstetric, and neonatal pathology. Our approach aims to be comprehensive so that vaccination recruitment of pregnant women, linkage with the hospital, and training of traditional midwives, screening for malaria, care for vulnerable populations, education, and everything that is considered preventive medicine occupies 40% of our work. We are non-specialist doctors, but the confrontation with reality has trained us to give efficient responses to our local pathologies from the point of view of planetary health. About 10 professionals, doctors, nurses, obstetricians, and dentists carry out their year of compulsory rural service to obtain permission to practice the profession. They are a great help and an interesting stimulus. We have sufficient laboratory diagnostic resources, both X-ray and ultrasound imaging, and small intensive care unit, an operating room, and 19 hospital beds. A word about traditional medicine. The population use various resources of traditional medicine for the treatment of diseases. They got their shamans when needed, who have their own theories about etiology and pathophysiology, and use their own procedures to diagnosis and treatment, including a wide variety of plants. This is why our work must always take into account this alternative that sometimes collaborates in healing, but other times becomes a formidable obstacle. The first step to be able to properly serve our patients and create bonds of trust and dialogue is based on our respect for their beliefs. But we must present our scientific option on the disease and his treatment with an ambiguity, because the two visions are often incompatible. The patient or relatives must choose between them, and the hospital must take great care of its prestige in order to be an attractive and reliable option. Nuestro compromiso es con la comunidad. Estamos presentes y tenemos que identificarnos con nuestro medio. Nuestro medio son la gente, en primer lugar. Son las comunidades indígenas por las que hemos apostado y por las que estamos aquí. Y eso significa, pues, estar a su lado en las alegrías y en las tristezas, ¿no? En las dificultades, en los problemas, estar con ellos, intentar, bueno, pues, ser uno más de ellos desde nuestras posibilidades. Eso significa el capítulo de salud, capítulo cultural, capítulo de problemas familiares, capítulo de las lacras sociales por el alcoholismo, no estar la espalda a los problemas, por ejemplo, que se desarrollan por las salidas, los movimientos poblacionales, que por aquí han pasado grupos bueno, pues por ejemplo, haitianos, venezolanos, que emigran y que hacen unas vueltas grandísimas para poder llegar al supuesto paraíso, ¿verdad? Pues nuestro compromiso es estar aquí y entonces no podemos darle la vuelta, no podemos darle la espalda a nada de lo que pasa aquí. Entonces el medio ambiente es un elemento más también, el compromiso con la gente y con sus problemas pues hace que no podamos evadirnos de ello. Y la medicina es pues con nuestras posibilidades, ¿no? Intentamos evidentemente cuanto más tener más facilidades diagnósticas y terapéuticas. Aquí no es fácil, somos siempre en algunos aspectos outsiders, ¿no? Porque estamos siempre al límite de nuestras capacidades. Por ejemplo, pues en el hospital tenemos que enfrentar a veces problemas quirúrgicos y yo soy nefrólogo, por ejemplo. Mis compañeros hay médicos generales integrales, pero tenemos que bregar con cualquier cosa, anestesiar gente, hacerle grados, a veces unas enormes averías por traumatismos y tenemos que encararlo porque nuestro aislamiento no nos permite demorar la atención inmediata, ¿no? Ese es uno de los desafíos, dificultades y atractivos también de esto, ¿no? No hay gran presión asistencial porque la población es escasa, pero vamos a buscarlos precisamente para hacer medicina preventiva, ¿no? Eso es una de nuestras vocaciones importantes y que, bueno, no hemos inventado nada, coincide con todas las líneas de trabajo del propio Ministerio de Salud de Ecuador. Y así nos desarrollamos. Yo estoy muy contento de estar aquí, la verdad. Son ya para 6 años y no cambiaría esto por nada. Y además, pues me reafirma en mi vocación. Yo soy franciscano y me reafirma en mi vocación de trabajar por la gente.
Guzmán, muchísimas gracias por tu presentación. Realmente vuestro approach es planetario porque sobre todo es comunitario, como decías, ¿no? Y has encontrado un empeoramiento en lo que es, ¿no? el medio ambiente, digamos, los impactos, ¿no? Que la deforestación o en esta zona remota todavía no se ha llegado esos impactos.
Desgraciadamente se nota, o sea, la explotación petrolera, que no puede detenerse casi nunca, pues ha provocado unos derrames que han sido horrorosos, ¿sabes? Entonces eso afecta a la pesca de la gente, por ejemplo. Aquí la gente no tiene recursos económicos, vive de la caza, de la pesca y de su pequeña chacra. Si les estropeas el río, los has matado, vamos. Entonces, lo mismo, la codicia por la madera, que a veces se produce también entre la propia gente de acá, porque, en fin, el buen salvaje es un invento rusoniano, ¿no? La necesidad le obliga a uno pues a echar mano de lo que tiene, y si hay maderas valiosas, pues intenta por todos los medios sacar beneficio de ello, y de manera que eso también deteriora el medio ambiente, ¿no? Y sobre todo el tema cultural es muy fuerte, porque la gente pierde sus referencias y les pone en el disparadero de no tener asideros, de por cualquier pequeño problema, pues quitarse la vida, ¿no? Entre jóvenes, gente más adulta, añadido eso al problema del alcoholismo, ¿verdad? La violencia también familiar, ¿no? Todo este tipo de cosas es una de las dificultades con las que uno se confronta totalmente y que uno intenta, pues, en la medida de lo posible, darle respuesta, ¿no? No siempre uno no la encuentra, pero por lo menos estamos aquí para estar al lado de la gente.
Muchas gracias, Guzmán. La verdad es que es una presentación fantástica. Felicidades por mantener en un sitio pues, con tantas dificultades, ¿no? La esperanza a la población local, y un placer muy grande. Gracias.
Gracias a vosotros.
Thank you very much. And what happens, we switched the presentation, so sorry. Yes, he was Dr. Guzmán Bernabeu, a nephrologist who works in the Hospital Franklin Tello. And we have introduced first, so Oscar Chamat, sorry. You have been introduced, and now, yes, the floor is yours. You can start. Sorry for the switch. Thanks.
Thank you so much. That's the kind of things that happens when you are organizing these kind of events, live. So no worries, we are used to this kind of situation. Thank you so much for this invitation. It's an honor for me and for Metropolis to be here in a project and in an event with these characteristics where I'm feeling a little bit strange here in some way, because you are talking from the jungle and you're talking about biodiversity, you are talking about migration, and I'm going to talk about cities. That is something that collects and generates all this. First of all, I need to share my screen. Give me 2 seconds, please.
Presentation now? Yes? Okay.
It's here, no? Do you see the presentation?
No, not yet.
I'm already sharing this presentation. Let me know.
Yes.
Yes, it's okay.
Perfect.
I can see here. Okay, thank you. Okay, as you probably say, Vanessa, we are working in Metropolis. Metropolis is the Global Association of Metropolitan Areas. We are an association. Sorry. Yes, we are a global association that its membership is coming from more than 140 cities all around the world, from capital cities up to cities such as Barcelona, Montreal, Guangzhou in China, South Africa, and Gauteng in South Africa. So we are a really interesting, I will say, mix of different cities on different needs. When I received this invitation to be here with this exciting name of Planetary Health, I was thinking, okay, but what are we doing in this dimension? And I was thinking, okay, let's try to look what our guidelines for the 2 years for the 3 years that we are working, which are our guidelines. And I realized that we are focused right now working on urban growth, resilience, public legitimacy, and digital disruption. What is interesting for me is that all those words have appeared in some moments in all the presentations that I've been present virtually, obviously, yesterday and today. In some moment, all those words appear. So it makes me feel more at home when I think in this way to say, okay, we are all talking about, in some way, something that I can share some initiatives. 2 years ago, I was in Tangier in a global event of cities, and I was scared to be in lockdown in Tangier because it was starting the COVID. And in that moment, when it was starting the lockdowns and it was just a simple flu that nobody have to take care of, there was a common question that raised from all the cities that we are working. Is this the end of the cities? Are the cities going to be changed forever? What's going to happen in the future? Actually, this picture for me is very relevant, and they explain the transformation and the scare situation that was living mainly in cities. And at the end, what I want to share in this presentation here is what from Metropolis we are learning and some lessons from this experience to be working with cities on these 2 years of COVID. The first lesson, I will try to go very fast in order to have more inputs from all the speakers and attendees. Collaborative learning. I think that in some way, other speakers have already shared this. I mean, that we are in a paradox of a lot of information, a lot of data, but also a scarcity of knowledge and information. That's a paradox. But when it starts, the pandemic, all the cities asked to us, to Metropolis, to institutions like Metropolis, to say, okay, what can we do? And our first answer was, we don't know. Let's try to create a platform where all the cities, no matter their size, no matter if they are part of Metropolis or not, no matter the place where they are located, share what are they doing in order that other cities be inspired by those initiatives, but also to try to find collective answers to collective challenges that in more or less all the cities were facing. We were very, very, very surprised and very happy to see that we received more than 700 initiatives, and I'm still receiving. The cities are still updating and uploading initiatives from 34 countries and more than 100 cities. That was a symptom, I would say, to say all the cities, no matter the size, are sharing and they want to share what are they doing, and they want to share and to learn from each other. There were some days that we received initiative from a small village in Argentina of 20,000 people up to Guangzhou with more than 10 million people. And all of them were happy to share what are they doing. How we did that? How we create this database that is open to everyone is the website is citiesforglobalhealth.org. And we say, okay, please cities. That's important. We ask to the cities. We never ask to private companies. No, we ask to the cities to know what are they doing. And we ask, okay, let me know where is your country, your city, if the initiative that you are sharing is for which stage of the emergency, preparedness, response, or recovery, and which topic is the main topic that you are tackling with this initiative. Obviously, as we are as you can see, we manage cities engagement, economic development, education, gender, sustainability, governance. All these challenges are faced in a different way in different cities. Regarding this event, it was obviously that one of the most shared challenge was health, and we got more than 200 initiatives related directly to health. and they are absolutely diverse. Something that is also important for this kind of events is to, once again, the obvious, one fits all. It has been commonplace, almost shared knowledge that is obvious that we are in these kind of situations. So this kind of diversity is interesting to see. I just share with you 4 initiatives from the more of 200, how different cities managed to this emergency. For example, in Taipei, just before this initiative is 20th of March, if I don't remember well, if I'm right. And in Taipei, they say, okay, let's try and conduct a pandemic drill to know how are we going to face the COVID. Okay, they realized that it was impossible to close borders to avoid the movement of the virus, and they they conduct a pandemic drill regarding pneumonia outbreak. So they did that, but on the other side in Bogota, the Fábrica de Licores is where the public entity that produce all the alcohol, whiskey, rum, aguardiente, this kind of liquors, they say, okay, let's stop producing this and let's produce alcohol for the hospitals, because we don't have any kind of alcohol in hospitals. So it's easy to see how different responses were addressed or were implemented in order to tackle all these issues of health. For example, but something that is very interesting in Belo Horizonte, they continue investing in health infrastructure. This initiative is from the end of 2020, 21, sorry. And they continue investing in the health system, even though the pandemic was in some way under control. On the other side, initiatives such as Vicente Lopez in Argentina, this is a town of, like 100,000 people in Argentina. They decide to implement a hotel for the doctors, for the people who was working at the hospitals. So what we have realized from this, what we have learned, what I think that is useful for cities to live in this paradox, as one of the speakers say, that we are living that economy versus life, biodiversity versus life, these kind of elements. What is important for policymakers? I think that these 3 words, it's all about caring, it's all about people, it's all about inclusion. Once that, no matter which sector of the public or city are you working in, I think that these 3 elements are one of the main conclusions that we are, one of the main lessons, not conclusions, lessons from this pandemic, from the metropolis and the policy-making perspective. The second, pandemic changed everything. And also, it changed the priorities for cities. Once at the start, the pandemic started, and we say, okay, but this kind of emergencies will be more frequent, will appear more frequently in the near future. So we need to create some kind of elements for policymakers, for cities, to try to deal with these kind of emergencies. Previously, it was mentioned the migration, the dry corridor. I think these kind of elements are emergencies that are complex, that are not like an earthquake, like a fire, to say this is kind of complex and multidimensional emergency. So we are still working on these documents that try to answer, so try to share some policy recommendations on different issues. This is a project that we are working with London School of Economics and the UCLG, that is like the UN of cities. And we are working collectively in trying to understand what can cities do, what can cities learn from this pandemic. One of the things that it was most shaking for me is how the SDGs have changed before and after the pandemic. This map shows how changed the priorities in cities in different regions. It's very interesting what happened in Latin America that has a weak health system, and health goes up to the top as a priority in implementing the SDGs. But also, it's interesting to see how the priorities in Europe didn't change. Health is still in the third place, environment, utilities. What it could mean that at the end, you start working for those things that you are not able to deliver to your citizens, to your people. Those priorities, going in more detail, that we have identified are 3, 4 that are critical and very important to keep in mind when we are talking about future emergencies and the health in general. First one, the mental health and well-being services. Second, something that is very important that very often is not taking into account the quality of high quality public space. That's something that appears with tactical urbanism all around the 15-minute cities on the move in everywhere. Care services, digitalization. We mentioned previously about data that is important, but also scaring, I would say, concerning, not scaring, that the education seems to be that have lost its space, even when given new place and new priorities to elements such as transport, social services, and housing. That is important to keep in mind. And this last section, a new leadership. No matter what do you want to do in the future, you need a new way of governing, of leader, of making reality the leadership in cities. It's needed to understand that the cities are too complex to leave them only to politicians or to urban planners. We need a new way to approach how are we going to deal with the health and the quality of life of people in people's quality of life in cities. I will skip this presentation. This is a slide. Oh, I'm sorry. This one. What we have learned from this same project that we are working with London School of Economics and the UCLG.
You have 1 minute, please.
Yes, no worries. I would like to finish with 3 words. Thanks. Governance by empathy, that's important. Multi-level, that is coordination and working together, and not to be scared to experiment, to experimentation and innovative approaches to governance. I think that is probably theoretical, but it's important to keep in mind these kind of elements. So as a brief and as a wrap up, the 3 lessons that we are getting from this, cooperative learning, cities, governance, are critical. But something that I have realized, and please 30 seconds to share with you one important message on this. Caring and cities need a new leadership and needs inclusion. And it also means to understand that women are critical and absolutely relevant for any policy regarding health, regarding biodiversity, regarding economy. And I think, and personally, I'm one of those that I miss to highlight the importance of having a new approach to women and gender in any kind of dimension that we are working on. Thank you so much, and I leave you with this slide. This is a contest we launched last year, and we asked children from all around the world to say, how do you imagine the cities of the future? This is the winner. This is a complex drawing that shows in one side the past and another side the future. Thank you so much. And Vanessa, I'm sorry if I take.
Thank you very much. Perfect. And now is finally we are going to connect with Roderick Guigo, who is Dr. Roderick is a computational biologist. He obtained his PhD in 1988 in evolutionary ecology at the University of Barcelona. He currently coordinates the bioinformatics and genomics program at the Center of Genomic Regulation, where he leads the computational biology of RNA processing research group. He's also a professor of bioinformatics at Pompeu Fabra University. He has participated in the Human Genome Project, as well as in other genomics and functional genomics projects, such as ENCODE, GenCode, Blueprint, etc. And he has awarded many times, for example, the City of Barcelona Award for Scientific Research in 2002, or in 2017, he was awarded by the National Research Award for his research career. Thank you very much, Roderick. The floor is yours. Thanks.
Thanks a lot, Vanessa. Thanks a lot to organizers. I'm really sorry that I cannot be in Andorra. I'm going to share. I think I'm sharing my screen. Can you see it?
Not yet. Not yet. One moment, please. They are connecting.
My talk may have a slightly different angle, so I'm a researcher, and I will. Yeah. But I still think that maybe actually useful in this framework.
Now is here. Yes. Roderick.
Now you can
Thanks.
see my. Yeah. Okay. Well, thanks. So yeah, as Vanessa said, I actually participated in the Human Genome Project many years ago. So actually, more than 20 years ago, the draft sequences of the human genome were published. This was the result of large process as a project that lasted almost 15 years. It involved hundreds of scientists all over the world at the cost of $3 billion approximately. And actually, it was heralded as a paradigm shift in treating disease. And it was claimed that it will change the way in which we were living and deal with health. And actually, it was simultaneously announced by the President of the United States and at the time Bill Clinton and the First Minister of the UK, Tony Blair, as one of the most important achievements in the history of science or biology in particular. And probably a slow match, not as fast as we would have loved or would have liked it, or slower than anticipated. The thing is that the sequence of the human genome is transforming the way in which we are practicing medicine. And there is now the emergence of what's called national medical genomic programs or precision medicine programs, with the aim of including the sequence of each of us, of all the citizens, in the medical records, and use this sequence together with other information to diagnose and treat diseases, or actually even to prevent the diseases rather than treating them when they occur. So there is now another project underway, which I think is even of more ambitious nature, which is called the Earth Biogenome Project. This project aims to sequence the genomes of the about 2 million eukaryotic species that are known to live on Earth in the next 10 years. So this is just an estimation of the number of species that live on Earth is really unknown. The estimated range from 3 million to 10 million, but we have a knowledge of about 1.8 million eukaryotic species, and the aim is to obtain the genome sequence of these species. As you know, we are in a critical times in terms of loss of biodiversity. There are thousands of species that are threatened with extinction. There are species that are likely disappearing every day without actually, it will even not be ever know that they existed on Earth. Some people claim that we are on the 6th great extinction, mass extinction on Earth, the last one occurring 60 million years ago. And for some, we are actually witnessing a comparable event of mass extinction. As I think has already been discussed, the loss of biodiversity has a direct impact in human health, because biodiversity supports food security, dietary health, livelihood sustainability. So a diverse diet is essential to to get the necessary supply of vitamins and micronutrients. Biodiversity is very important for medical research. You know that we use animal models for diseases. It's the most used animal model. There are other species that are actually better model for particular conditions, for instance, bats for diabetes or bears for osteoporosis, etc., etc. Natural products are the sources for many drugs and traditional medicine treatments. Taxol, for instance, cancer drug. The loss of diversity actually is behind the emergence of many of the recent outbreaks of epidemics. Some of the SARS epidemics or avian influenza, etc., etc., have been attributed to loss of diversity. Biodiversity has spiritual importance. We know that living in an environment which is closer to the nature actually has direct impact into the psychological and actually general health. And biodiversity is essential for climate change adaptation. Actually, loss of biodiversity may also contribute to climate change. And ecosystems are actually, intact ecosystems are a better way of, are more resilient to natural disasters. So currently, I mean, there is still a limited knowledge of the genomes of the species on the Earth. So this is a logarithmic scale, and if you look at the number of species for which the sequence, the genome sequence is known, this is less than 0.5%. So there is a huge effort to, within the next years, if actually we want to characterize the genome sequence of all the species, of all the eukaryotic species on Earth. So this Earth Biogenome Project is actually a network of networks of the world that address either taxonomy. They are oriented by taxonomic groups, either sequencing all the vertebrates or all the insects or all the beetles or whatever, or actually some biogeographical regions. So one of the most advanced such projects is the Darwin Tree of Life. The aim of this project is to sequence the genomes of all the species on the British Isles, which is about 60,000 species that are known there. And the project is actually quite underway with a large funding from the Wellcome Trust. The Wellcome Trust is it's an organization in the UK that actually supports research in human health, in medicine, and actually has strongly supported this project with initial grant of 50 million pounds. We're actually, with Andorra, we are very happy to collaborate with Andorra in this Catalan initiative for the Earth Biogenome Project, which is with funding from the Catalan Society for Biology, aims to sequence also the species of live in the Catalan territories. And we are already sequencing the species of about 40 eukaryotic species, actually 3 species from Andorra, and are already part of this pipeline and of the larger effort, which is called the European Reference Genome Atlas, that aims to sequence all the species that live in the continent. So I like to finish because it may not be obvious why it's the value for human health. I mean, I think it's probably obvious or can be understood that the human genome sequence has an impact on understanding and knowing the human genome sequence. And all the genomes are actually the set of instructions that encode the biological traits of living beings. They actually encode our propensity to be affected by particular disease or our response to treatments for diseases. It is less obvious how the sequencing of the lion genome or the sequencing of the genome of a butterfly or of a plant that lives in the Pyrenees and the mountains of Andorra, what is going to be the impact of this in human health. And I'd just like to finish with 2 examples on why this is actually important and how the knowledge of the genomes of many species can have a direct impact on human health. And these are recent papers published last year in which actually show examples of this. So the first one is a paper published in Nature, like maybe a year ago or so, in which these researchers use machine learning methods to compare the sequences of many mammals that are known at this moment, and by looking at the changes in or changes and the changes in particular regions of the genome, they can actually predict which changes in the human genome are going to be could be actually associated to particular diseases. Another example in terms of COVID, this is another research in which the comparison of the sequence of the genome of a few hundred vertebrates, in particular the region of the genome that encodes this gene AC2. This is the AC2 is the gene, is the protein that acts as a receptor for SARS-CoV-2, the virus that causes COVID. And by comparing the sequences of the gene across this vertebrate species, the researchers were able to predict which species were more likely to suffer to be susceptible of COVID-19 if infected by this virus, and this has importance in actually two directions. In one case, as you can see, some of these species that are more likely to be infected by SARS-CoV-2 are critically endangered, and for some of these species, losing 10,000 individuals means the end of the species. They are really critically endangered, but also because these species that are more likely to be infected by SARS-CoV-2 are also the ones that could be vectors of the disease in humans, so to be able to transmit the disease to humans. So, and I think I will leave it here. I hope that this genomics angle also contributes to the discussion today. Thanks a lot again for your attention.
Thank you very much. Thank you to all the panelists, especially to those who now must be sleeping, but now maybe we can address some questions to them. I don't know if would you like to make any questions to some of our experts? Yes. Maybe you need the microphone. Somebody could, yes? Or well.
Hi, this is a question addressed to Oscar, I think, from, have you ever considered that country, I come from a small island called Malta, and we are as such not a metropolis, technically speaking, but we're so densely populated that in reality you can consider sometimes the whole island as one big metropolis with, let's say, gaps and villages connected closely to each other. So, have you, in your equation of sharing these initiatives, have you considered also sharing these initiatives to countries that have high densities? Thanks. High population densities. Thank you.
Thank you so much for your question, because it's important. It's a debate that we have inside metropolis. What is a metropolis? No, at the end, we have to define some red lines just for a matter of coherence and make it easy for us to manage. So we decide that a metropolis for us is a city of more than 1 million people or a capital city. We did it just for operative reasons, but at the end, you realize that the cities, that a metropolis has more or less the same problems that you are mentioning. A big metropolis that we are working with have more or less the same problems that you mentioned, that a big city is surrounded, I imagine, I don't know your Iceland, is surrounded by different cities around them. And you live in one city, you sleep in one city, go to groceries store to another city, and go to the cinema to another. This is a metropolis at the end. But for us, for Metropolis, for the Global Association, we need to say, okay, this is the kind of metropolis that we are working with. Regarding the City for Global Health platform, it's open to any city. It doesn't matter if it's a big, small, huge, or a megalopolis. So it's open to everyone, and you are invited to visit. I don't know if I answered your question, but it's just a matter of be practical in some way.
Okay. There are more questions from...
For Roderick, thank you very much for waking up so early in Boston. You've been also waiting 1 hour, so you should applaud him, I think, but okay, thank you. Your research in the genomic field, do you think these species that are disappearing, no? There are many species that we want or not are disappearing. Do you think it has some influence, the research, the genome of some of these creatures? Do you have, it has some influence in legislation to preserve these, or how do you feel, how do you try to connect both fields? Because
yeah. So there is, there is an area called conservation genomics, right, in which the sequence of the genome of the species is being used to understand the causes why some species are get extincted, because even though the threat to the environment may be similar for species living in the same ecosystem, some species are more resilient than others, and therefore, and this is probably encoded into the genome sequence. So the genome sequence gives some information about the reasons why some species are more resilient to environmental impacts. On the second hand, the genome sequence allows for genomic intervention. So it means this is a little bit controversial, but you know that now we have methodologies that are able to edit and change the genomes, and these technologies are being used, for instance, to control plagues. So there are cases in which the genomes of alterations that are artificially introduced in some species to maybe to reduce them because they are a plague, or actually to improve the way in which other species act as predators of the plagues. So there is a connection between the sequence of the genome, or a capacity to protect these species that are in danger or that are a threat to biodiversity. And of course, on the other hand, many species are sources of natural products, and if they disappear, natural products, natural drugs, if you want, if they disappear, we will lose the capacity of use these products in medicine.
Okay, thank you very much. So maybe there is some questions from the streaming channel. I don't know. If not, we can address some of them. Because, well, we have been talking a little bit about how migrations are attracting people to metropolis or to more less rural areas, no? And maybe one question could be how we can manage this in order to continue to be solidary, no? Accepting migrants, but also to be able to develop sustainable policies in order to at least to be in an equilibrium and not and trying to use the capabilities and resources in the better way. Maybe you can give or some of you.
No, basically, what I think is also again going into inclusion. The problem sometimes is that you sometimes work with a city, basically, and you go to the health authorities and you talk to them, and they say, "Oh, we have this big issue now because we have these many people coming from the other country, you know. So now our services are overstretched." And then you ask, since when is this happening? Oh, 40 years ago started, you know, this flow started 30 years, 40 years. So basically, it's interesting because it seems that some countries are still seeing migration as a separate, as an humanitarian issue, as a solidarity issue, but not really thinking into the inclusion concept of really, you know, engaging with those communities and really making them part of they're part of the context, but making them part of the system, and that's the main challenge. I think that we do have now a really good opportunity in terms of the global agenda. So, you know, the big umbrella of the SDGs helps a lot in terms of universal health coverage. So that opens a lot of opportunities for us. But also, we need with also the muscle from the field and the muscle from the communities, telling our authorities of the importance of including all populations within the health service.
Thanks. Well, I don't know if we have time for any other question. Maybe one more. And there is somebody who wants to ask something to the panelists. Okay. Well, maybe finally the last question from my side is that, okay, we have been talking about social and economic indicators, but which, from your point of view, which of them could be the most, the one or two most important indicators that are the thing that has to at least put on the table the politicians and all these kind of people who take decisions in order to say, we cannot continue like this because this or that, because it's not easy, huh? But if you can at least think in one or two indicators that are maybe the most considerate. I don't know if some of you have wants to answer them. Yes, Oscar, thanks.
I would like to once again underline the importance of inclusion, and if we need to think what means inclusion when you in kind of indicators, I will go to analyze what kind of data have been collected, for example, during the pandemic, in terms of gender, for example, or age. What happened with kids during the pandemic regarding the data? Do we have properly data for them? And also, once again, sorry for being annoying regarding the gender, but I think that is an important shift in our frameworks in designing policy making, in designing policies for cities and metropolises. Thank you.
Thank you. Thank you very much to all of you. It has been a pleasure to moderate this roundtable. Jordi wants to...
Thank you very much. It's been the most biodiverse, by the way. The most difficult one, so very well done.
Thanks.
An applause for everybody.
Thanks to everybody. Thanks. Thank you.
Just one final also question for Javier. When are you going to start building that center, amazing center?
Well, I think we will start next January.
Fantastic.
Yes.
So any help, any resources,
yeah.
Contact Javier. He will need them for set up this planetary health research center in the very remote area. No? Thank you very much.
Yes.
Thank you very much. Thank you. Now we should make a summary, but I think we should go because our objective is to stay here until 2. At 2, we promise we will finish. But we have two closing talks, no? In that sense. So thank you again. You can walk 1 minute, but you will have to come back here so for the closing takes. And thank you very much. Thank you very much for the 5th. So meanwhile, let's again, because I cannot do it so well as Mr. Stefan from Malta, get up, stand up, just to make the final, just 1 minute, because meanwhile, we're gonna open the... We need another chair. Necesitamos una otra cadira. Sí, sí. We have now 2 closing talks of 15, 20 minutes max, where we're gonna ask people final statements, final considerations, and it will be the draft document.
Okay, welcome back. Let's move now to the last part of this international conference, to the closing talks with different of the experts that has come to attend this event. And also we want to the audience and all the participants to be engaged in these last discussions. In the first open close talk entitled Towards a Healthier Planet, we have with us Christina O'Callaghan, Deborah Thompson, Carlos van der Laat, and Salvador Mazip.
Thank you very much, Laura. It's been a pleasure to have you all here. In this time, it will be my turn to moderate. So I'm going to sit down, and we're going to start. Thank you, Christina, to be again today with us. It's a pleasure. You have a very busy schedule these days with exams, so thank you very much. So let's start with precisely Christina. No? Christina, planetary health. Do you think that this terminology and the scope of this field is here to stay, or it will happen like the other evolutionary terms, no? Global health, One Health, and do you think it will really continually evolve in that sense?
Well, I think the concept of planetary health is here to stay at least for a few decades. Let's hope we solve all the problems and then we don't need to talk about planetary health in the future, but I don't think this is the scenario, unfortunately, and the challenges that we face on today will make planetary health even more relevant. Regarding the evolution of other concepts, I think global health and One Health, the scope of these disciplines are slightly different, and although they are both included in the concept of planetary health, they tackle slightly different problems that, of course, are still relevant nowadays.
Thank you, Christina. Carlos, thank you very much for your amazing talk before about migration, very clear points. Some of the sentences should be hanging on the wall, by the way. Thank you. Which are, just from an institutional point of view, which are the irrenunciable steps that institutions in countries and regions should take to improve planetary health? If you want to focus in migration, for example, one of the topics, which things states, institutions should not renounce?
I think it's multi-sectorial approach also. I have been working for migration for the last, 12 years, and it's quite challenging because you go to the health sector and they don't think about, the health sector really don't think about mobility. You know, we're in the health sector, we're very national-wise. We usually, our strategies are, our plans are national-wise. Everything is done at national level. All the maps you see, all the epidemiological maps that you see are also only in a country, you know, in a specific context of a country. And then you go to the migration sector, and in the migration sector, basically they care a lot about remittances, they care a lot about passports, documents, but not necessarily about the health of the person who migrates. So I would say that the main challenge, and that's why planetary health is such a good umbrella also, because I think that we can basically broad, you know, the approach and allow or oblige people to sit together and start talking about different, you know, about migration health issues in a more solid way.
Thank you, Carlos. Thank you very much. Deborah, you were so amazing. When fresh start, we start with you. How we can include or accelerate these educational concepts, no? into many educational plans, no matter medicine, biology, economy. You talk about children, but what do you think about more adult educational plans?
Yes, thank you for the question. Whenever I speak to medical students, whenever I speak to veterinary students, or even environmental health students, I play in the fact that we don't live in a bubble. And we have to think about not just the patient in front of us, but the environment that the patient comes with, the family that the patient comes with. For people who are undergoing migration, is it because there was a severe drought and all of their animals died, so they had to leave because there was the drought, plus their money source, right? Their financial source was completely gone. So it's that looking at that entire picture and improving the collaboration between people of all different backgrounds to solve these complicated planetary health problems.
Thank you, Deborah. Dr. Masip, thank you very much. You are very used to be interviewed to try to educate, general population, but maybe also politicians. I don't know if this is your objective, but how do you think researchers, can influence to the policymakers, in a serious moment like the one that we have experienced, How can we improve that?
I think it's a key question, and I don't know if I have the answer, but I think the first step would be for us researchers to be confident enough to cross the border from the lab into the real world, because we tend to be comfortable in our setting and we control our kingdom, which is our lab. But that has a particular set of rules, a particular kind of language that we cannot use in the outside world. And one thing I always say is that science works for society. And science is advancing knowledge, yes, but with a goal. And that goal is returning to society something. Society pays for our research, pays our salaries mostly. And we need to be able to learn how to communicate. And that's something that needs to start at the university level. There's very rarely, or at least when I was studying, was nothing on communication, on scientific communication or in popular communication. This needs to be implemented in all schools and universities, and then we scientists need to do that step and get out of the wall and communicate to politicians, to the public, and then obviously there has to be the opportunity to do so. And I think during the pandemic, this has changed a lot, and we've seen now media open up to scientists, which is something that it was more difficult before. And I think this is something that hopefully that will stay on now, and there's going to be a more fluid channel between science and society, which I think is key.
Thank you to you and all of you. Because here we have two researchers, one educational activist, and you work in international organizations, but a special one. It's a very special international organization that is tackling with things that some countries don't want to have nothing to do. In that sense, do you think? I'm not saying that we have to twist, but when you see some governments, some institutions, some enterprises that are not aiming, at least from an ethical point of view, what it would be the objective to save the planet, do you think you could also use these arts, and not twisting, but research? I mean, trying to, it's impossible. You have to be honest with yourself and to be transparent, because sometimes you say, with the issue of fake news, with the issue, how can researchers, activists, why you don't have more strategic, I wouldn't say Machiavellic, but plans, to really convince these people that are playing with fake news, Anybody of you?
I think it's two parts to that answer. Number one, we need to become better communicators. We need to know how to speak to influencers, and that's why I wrote the book, The Art of Science Communication. But particularly, we need to know the needs and the wants and the priorities of our audience. Is it an election year, right? What are the main concerns of the constituents, of the voters? Who are the people who are really changing the path for the governments of wherever you are living today? Think about what they want and angle the message of Planetary Health to meet their needs, because it's about them, right? It's not about us, it's about them. So how do we move forward in the planetary health space? We have to make sure that we angle it properly to meet the needs of the influencers.
I think that there's a word that it may sound like a bad word, and I think it's important in all this, which is marketing. And we lack this ability mostly in science and in our field to market our research, our findings, our tools, our policies, and it's the way the world works. Everything is marketing, and so marketing is a component of everything. You can do the biggest discovery in the world, but if you don't get it out there and you don't communicate it well to your peers and to the public, it's not going to go anywhere. I mean, the example of we saw Alexander Fleming discovering penicillin, but that discovery stayed 10 years hidden because he basically didn't publicize it. He didn't market it well. He didn't manage to convey the importance of that story until Florian Chain actually found it and unearthed it. So being able to market our needs, what we think needs to be done in terms of all these of all the things that can affect the planet, I think it's one of the key things that we are lacking, and we need a bit of training on that.
Carlos, Cristina, maybe the same question because it was a little bit Machiavellic, the question, but society, education, democracy, do we need to convince people and educate, Christina, do we need to convince people and educate people? Or you need to convince Elon Musk of every time, and that man, you are a particular teacher of him, and then the planet will be safe. What do you think?
I think none of these strategies are exclusive. So I think we need to raise awareness in general in the society, but also we need to train professionals that can lead the needed change, and to say somehow translate the needs and the wills of the social society. So we need to raise awareness first. Population needs to be aware of the challenges we face and of the crisis we face, and be ready for the changes that are necessary in the way we live, in the way we consume. Otherwise, the challenges, the policies that people with a deep knowledge of the situation would try to implement would not be accepted. So first, raising awareness is super important. Then training specialists that can lead this change, and as my colleagues were saying, can convince policymakers that it's important and relevant to make those changes. And convincing Elon Musk that this is important, I would say it's part of the marketing that Salvador Masip was talking about.
Thank you all. Just a final comment from me with you, a final wish. I would ask you all, 10 seconds of how you think you can work better with other disciplines to bring silos together, and 10 seconds for a final wish, final comment, final statement. Carlos.
Yeah, I would say to really include groups of population that are not being seen. I mean, some of them don't want to be seen because of all the barriers, all the structure, all the xenophobia, all the discrimination. But us as planetary health providers, we need to really be inclusive. We need to go there and look, reach out for them and really include them. That's the
final wish.
I would wish. Oh, that's really difficult, to say. But I think that. At least for planetary health specifically, I think that my wish would be to really try to always think about those groups specifically. I mean, really include. I'm not talking only about migrants. I'm talking also about indigenous communities. I'm talking about many different groups that are basically being left behind, and so we really need to focus on them and tailor our messages. We need more evidence, we need more data. There's still a big gap in terms of data regarding those populations. So that's also very important. We need innovation also. I don't know why in the hospital, in the same city, they have this big scans and big computers, but if in the clinic attending, or providing support to migrants, there's a paper there and the doctor is writing in a paper. That's two different worlds, in the same.
Yeah. Thank you very much. Very interesting. He did 40 seconds, guys.
I'm sorry.
I only give you 10 and 10. Deborah.
I'll cut it short.
Deborah,
Thank you.
Silos.
For medical and veterinary silos, for instance, what we could easily do is have a conference, for instance, where we give credit, continuing education credit, to both the physicians and the veterinarians, bring them into the same room and have them learn together. Very practical. Wish. My wish would have a combination of the two definitions, One Health, Planetary Health. It would be the One Health approach is teamwork between people of different backgrounds, disciplines, and strengths. We come together to prevent and solve planetary health problems.
Thank you, Deborah.
For me, the first thing would be to have more people on the interface. So this is a multidisciplinary thing, so we need people that speak more than one language. We need clinicians that understand science. We need scientists that understand communication. We need communicators that understand marketing. And all this is, I think, what we need to create in the universities. Just build these people that can have one leg in one place, one leg in another, to bring together, to stitch together all these different areas.
Yeah. A wish?
And my wish would be more coordination, which I think is something that we've seen in the pandemic that was lacking. So to bring all this together, we need to somebody at the top being able to pull the strings and coordinate, bring things together, get a panel of experts worldwide that can make sure that the efforts in all the corners of the world and in all the areas are working together towards the same goal.
Thank you very much. Christina, you are the expert in planetary health, and thank you very much for being here from the beginning. And you're expert also in education with your master in planetary health. Silos, how do you bring them together?
Well, I think it's clear that working in multidisciplinary teams it's a challenge and requires specific skills. So I think it's important that researchers see the benefits of having this investment in working in multidisciplinary teams. And second, that research funders truly promote multidisciplinary research. Because I think the experience of many researchers is that when trying to do multidisciplinary projects and putting lots of effort, like the extra effort that it requires in setting a multidisciplinary project, then they receive many criticisms still by the funder agencies.
And wish, a part of having 100 students in the master next year, which if some of you want to go to the master, you wish?
Well, basically related to that the educational institutions embrace the concept of on planetary health and work for the training of a new generation of professionals, either by the inclusion of content related to planetary health in any degree, or by working in the promotion of courses focusing on planetary health, like the masters that we lead.
Thank you very much. We have finished the first closing talks. A big applause for the. Now we're going to move to the second closing talk. We are aiming to do it in 15 minutes, if possible. So let's go. Thank you very much. Thank you, Cristina. I don't know if we have Miguel Angel with us online. Can you check, please, if we have Miguel Angel? Now. ¿Presentas? No, yeah. Sit down. Miguel Ángel y Arnau. ¿Tu nom, Arnau? Es que no tenía punta de Arnau. Arnau Calvet. Arnau Calvet. From
Andorra Research o
no, from SBC. Escolta. Com era el teu... Al final com vam quedar? És que ella no tenia programa.
Envio i SCB Andorra.
SBC?
SCB, Societat Catalana de Biologia Andorra.
Vale. Arnau Calvet, SBC Andorra. So, thank you very much. I don't know if we have Miguel Angel online. I don't know if we have Miguel Angel online. Yes? Clara? Okay, let's move.
Yes, let's move to the second open closing debate, entitled Towards a Healthier Planetary Health. Here we have Miguel Ángel Royo Bordonada, Pedro Albajar, Clara Prats, Marco Inzitari, and also Arnau Calvet from the CBC Andorra. Arnau, we welcome you to this conference. So, Jordi,
thank you.
The floor is yours to moderate the discuss.
Thank you very much to everybody. Again, thank you, Clara, again, for being here today. She was here physically yesterday. We appreciate it a lot. Thank you again, Miguel Ángel, for being here. I know that you left your classroom now.
Yeah.
Thank you. Thank you very much. No, so we have with us also Pedro Albajar, Marco Citari, and Arnau Calvet. First question, also Pedro. Again, a little bit, we will not repeat all the questions, but planetary health concept, Pedro, is it going to evolve? Is it going to be mixed with others? What do you think?
Well, both names has interesting approaches. I think we have to discuss that with communication experts. One Health, Planetary Health. What we need, and that is my message, is kind of glossary. We have a lot of people now speaking about different concepts, and frequently you ask, what do you mean about that? I think something not just about choosing one or another word, but definitely to try to be more precise and to be, I don't know, it's essential to know what we want to mean when we express some words. So Planetary has a lot of advantages, this concept of one health, etc. as well. The most important thing is to maybe to speak more, to have increased the dialogue in order to have good definitions that are useful definitions for action.
Thank you. Marco, could you name or propose some synergies between how to promote healthy aging and a more healthy planet?
Yeah, of course. I mean, I'm sure there are synergies, and I think that also the WHO and international organization are proposing this synergy. For example, we know that one of the main problems is sedentarism and insufficient physical activity for healthy aging, and Eva Eras and myself have been showing that about that. Transportation is also a problem which is affecting the planetary health. So finding new ways, new shapes of transports which can promote more active lifestyle, that could be a win-win between better, less individual transport and pollution and promoting physical activity. On the other hand, for example, we have nutrition is one of the main points to promote physical activity, to promote healthy aging, and we know that disadvantaged older adults are a lot, and they have difficult access to healthy food. So there are in this moment many projects looking at new sources of healthy food, for example, proteins for older adults, based on insects, for example, how to derive food and proteins from insects. So that could help also the planet to have more accessible food, less meat, and with all the pollution-derived problems. And probably the third one I would say is like we are trying to promote aging in place every time more. So how do we reshape the housing for older adults, and how do we make this housing more accessible, more connected, more green, and more efficient from an energetical point of view? All these, the two things, have to be together to build this win-win, and I'm sure that there are many things we can do.
Thank you, Marco. Miguel Angel, I don't know if you are in the first closing talk, but what can the government, what they cannot renounce about? I mean, you said yesterday how difficult it is to implement food policies, no? Many barriers, budget, legislation. What should not the governments renounce to?
Well, I will say governments should not renounce to their responsibility to regulate the food environment in the world. How the food is produced, is distributed, and is consumed around the world. Because the sustainability of the world itself depends on that. And this means mainly to regulate aspect that has to be with mainly agricultural production. This is basic, and also marketing and prices. Those are fundamentals. If you allow me also to share this, to share a slide of Is Global to see regarding the concept, as you mentioned, of planetary health. I think this is an important concept, but because it encompasses all the other concepts we have used, like public health,
20 seconds, Miguel Angel, 20 seconds. If not, so, I will blame you for being late.
Yeah, it includes all things. I think it's important because it reflects the importance that if we, what we do to the planet is what we are doing to ourselves, our personal health.
Thank you.
So I think it's very, very important, and the government should be aware of his commitment and responsibility with planetary health.
Clara, thank you, Miguel Angel. Thank you very much for being here both days. Also, Clara, how can we boost planetary health with fresh data from many disciplines?
Nice question. Sorry, I'm not here today. It was better yesterday. Yeah, in place. Well, I think that we have to. Well, we must take advantage of the momentum that the pandemic has given us. I mean, the pandemic has demonstrated that analyzing data with different nature can fuel enormously our knowledge. And what we are seeing is that our planet is a complex system where complex relationships between the different actors and phenomena and variables must be discovered, must be understood in order that we can work for better solutions. So at least I think we have demonstrated that it can be done if data are there. The improvement, of data, of information systems has been incredible these 2 years. So I think that we have to take advantage of such progress and keep moving towards open, supranational, and interdisciplinary repositories of data.
Thank you, Clara. Now, you're the youngest, no?
Yes.
You're the future, and you're from Andorra.
I hope.
No? How do you see all that? Just an open question for you now, for the moment.
Well, nowadays this is difficult. That's true that nowadays there are appearing now diseases affecting tracks that before there were not known. Like, I don't know, no new respiratory diseases, now autoimmune diseases, and this is all for all the globalization, all the industrialization, right? Then also what is a problem that I think we are on a first one. We are in a developed society where we are constantly protected about all the risks about the bacteria. We are all the time taking antibiotics, drugs, and this is also a problem. Why? I think that this overprotection of our body also generates these diseases like autoimmune diseases, because we are not preparing the body to the exterior. Also, what negative things of the pandemics is of the teleworking or the mask that also provokes a lot of diseases, like a lot of respiratory diseases.
Now, by the way, your generation.
In my generation.
No, you're doing very well, but we have to. Your generation. Do you think that your generation will be involved? They are engaged. Do you think that they want to fight for all these big problems that all of the rest of the generation are leaving to you?
Well, we must do it if we want to survive. Not then, well, in this way, I'm happy to announce that here in Andorra we're doing a lot of things, and we are reactivating the Association of Biotechnology here in Andorra, and the aim is to diffuse science and maybe in the future to increase the investment, to activate the investing or the research here in Andorra, and that's. Well, I think that here we have the power, the young people, to do that, to diffuse this knowledge and to diffuse these aims to do science.
Fantastic. Think about your wish later. So, Pedro, and also the others, no? Very important, no? How we can improve the transdisciplinary work from an academical, from a research point of view, and from a pragmatical and projects point of view. Not only the silos question of before, but also even pragmatical way, how we can improve the interoperability that you are an expert of, how we can improve that.
Well, when I was speaking about glossary, I think we have to update a lot of things. We have to update roles. We have to update instruments. We have to update in order to be able to implement. I think this is the key. I mean, we have to implement projects that will be demonstrative projects, and that will be, at the end of the day, the best argument, the best justification, the best in order to engage other people. Definitely. Implementation, but with a prior update of everything we are doing. We cannot continue to do the same we did. We have to update and to implement.
Marco, Miguel, Clara, in your institutions, in the academical world, in your hospital, in your national institution, Miguel Angel, would you see as a great initiative to have a bonus from your institutions if you really work closer with others? Do you think it's possible?
I don't know if I can speak.
Of course. Sorry.
No, that's very quick. I think it's not only possible, but I think we are moving steps forward to do that. For example, the example I explained about the constitution of a living lab, that's a collaborative environment, ecosystem, where end users, in our case older people, research, innovation, administrations, companies work together, and also with different profiles. So this is exactly the kind of ecosystem and platforms we want to have, and we are going to do this in the few weeks, so we're going to launch it, so that's there.
Fantastic. Miguel Ángel.
Yes, I was saying that the Institute of Health Carlos III has launched a unit of environmental impact to put together the efforts of scientists from different fields that have some kind of impact in health, like environmental contaminants, food and nutrition, and so on. So it's try to put together all the brains that are working on that to prepare projects that integrate all those impacts in the same project.
Thank you, Clara. Are you there, Clara?
Yes, I am.
You were required by many institutions, although they didn't pay you more the last 2 years, no? So you were. So do you think if they pay them more, they will not call you, or how do you think so? What do you think?
If they pay who?
No, it's a joke. No, I mean, how we can implement these collaborations in university field? How these collaborations, how we can implement them?
I think that the first thing to have in mind is that transdisciplinarity does not mean that medical doctors must build mathematical models, neither than physicists like me are able to evaluate the economical impact of COVID measures, let's say. So I think that what we have to promote from the university in this case is this open mind to take advantage. We are forming students in specific disciplines, but we must create the spaces where they can interact with students from other disciplines by means of practicum, of the final degree thesis, and this kind of more practical things where they can collaborate with different disciplines. I think that we have to be there.
Okay, thank you, Clara. And now, again, no, how we can work together, and a final wish from Pedro.
Yeah, my final wish is to switch from a fragmented, competitive guy arrives and says or asks, what can I get from that? A cooperation, a collaborative approach. The question is, how can I help? I mean, to switch from a competitive to a collaborative approach, I think is a common denominator of this session. That is my wish.
Thank you very much, Pedro. Marco?
I think my wish is probably in this moment to activate, in my case, older persons, because they can bring a lot of solutions and be part of the solution. So we need to not only think about solution for them, but to involve them and make them part of the thinkers of the solution. So I think that's the wish I would like to see for the next future.
Thank you very much. Miguel Ángel, can you listen to us?
Yeah, well, I think the important is to create a movement upwards to make a great collective effort in order to change politics, to put pressure in the persons that are responsible of taking the decision, that are difficult decision but necessary decision. And all scientists, civil society, population must be together to motivate and stimulate this movement, which is necessary in order to have a sustainable environment in next years, next decades.
Thank you. Clara, your wish a little bit, and
yes.
You already talked about transdisciplinarity, but your wish?
My wish, if I connect, well, I share all the wishes that you have said. But if I have to add one and related to the roundtable where I participated, it would be maybe that what we have learned from the pandemic, these lessons that we have learned, keep unforgettable, not only in our minds, but also in society minds and also in politicians and policymaker minds.
Yeah.
And just to finish, I think that there was a sentence from Carlos this morning that I will write in my walls, which is nothing for us without us. I think it maybe summarizes most of the ideas that we have discussed here.
Now we have a surprise. We have Luis Casaña with us that he has asked 5 minutes ago to join. I think this is flexibility, but he's one of the fathers of planetary health. And I believe, Luis, we are just finishing. We had a very quick roundtable. Sorry, it's also very early for you in the East Coast. And just 2 questions, quick questions. Luis, how do you think we can work together, the different fields? And a final wish from your side for planetary health.
Thank you, George. Thank you, colleagues. So I think the best way to work together is find the common ground. So what we have in common, what we need to build together, and how you can build back better. So that's today is the big opportunity after this tragic pandemic, how you build this world better, more equitable, more sustainable, and more just. So that, I think, is the big call today. And if you find a common ground, then we normally, automatically, we will work together. The other is these ideas are very well structured in the Lancet Commission, in the academic community. We all are looking into that today. As you know, for a long time we are doing that. So it's now also time to pass on for the new generation. So I think teaching and researching with young people is a very important task for all of us. And again, George, thank you very much. It was a big pleasure to be here, and I wish all the best for this community to advance planetary health.
Yes, from you being one of the fathers of planetary health, we give the last word to a young guy, Arnau, from Andorra, and the future. Arnau, your wish.
Well, my wish, I think it will be to encourage all the young people, to join this movement. I think it's an opportunity to reach the goal that is to save the planet, or to save the planet and to save our lives, that it's linked, right? And it's very easy, I think, just by the diffusion of the knowledge, of the diffusion of some initiatives, like, I don't know, the simple thing to go to the mountain and take the trash that this is on the soil. That's just a little thing that changed a lot the way to and the safety of the planet.
So we invite your young colleagues to join your association, no?
Exactly.
What do we want, no? Thank you very much, Laura. Come here. So from young people to other young people, we really close. Come here, both the young ones, they're from Andorra, over here.
Okay.
So we close the conference. Let's go for it. Thank you very much, everybody. And let's go. Thank you, everybody. So we really close now the conference. A big applause for our speakers, Luis, Clara, Miguel Ángel.
Sure. Thank you very much.
Very well. So, and the last word for you, Laura.
Yes, thank you very much for joining us after these 2 intense days with amazing roundtables and also talks. We reached the end. We would like to thank authorities, partners, and the speakers who have traveled a long way to attend in person here in this conference, or that speakers that connect to us. We also thank all the audience that has been following us during these 2 days. So thank you very much. And we hope, to sum up, we hope that this conference will help, or has helped, to connect research centers, institutions, investigators, and all communities and general population to work together to obtain and to achieve a better and more equal and more sustainable world. So thank you very much.
And thank you. Thank you to the Ministry of Health, to the SAS, to the ARI Foundation, to the University of Andorra, and thank you very much. Thank you to the super technical team. A big applause for them. Tito, Toti, Sito, Balta. I've never collaborated with a wonderful name technical team. Thank you very much. So we hope we see you soon again. Thank you. Bye-bye.
Thank you.
Bye-bye. Thank you very much.
Bye-bye.